Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Rader, Washington, Williams. You have a quorum, Senator.
All right, thanks, Adam. For the members of the committee, my intention this morning is to probably work for, I don't know, hour and a half, 2 hours, something like that, and then take a break because we're going to go to the floor around noon, according to Cindy. And then whenever we finish up on the floor, come back, get through all the budget bills, and then probably take a little bit of a break, and then come back and do language this evening. We'll just see how quickly we can get through this. So we are on the Department of Public Safety, House Bill 8. Sarah, whenever you're ready.
We're going to start with Book 1. Begins on page 1. It's the Director's Office Administration. There's the House reduced by $1.4 million for a new decision item on page 3.
Sarah, I think we're going House on the core on page 1 and close, and then bottom of page 2, I've got a couple of NDIs.
Mm-hmm.
So we've got New Madrid County Jail, $500,000. We've got a Youth and Police Initiatives at $750,000. We've got a Greene County Public Safety Training Facility at $2 million, and a Cedar County 911 Communication Center at $550,000. Right?
Yes.
Perfect. Let's do those and close.
Page 3 is the new decision item for the crime victim notification.
Yep. House and close.
Page 4 is a new decision
Raytown, House and
item.
close.
Page 5 is a
Jasper,
new
House and
decision item.
close.
Page
Mileage,
6 is no
House and
longer
close.
needed. Page 7 is no longer needed.
House and close.
Page 8 was one timed last year.
Yep. House and close.
The middle of the page is a new decision item.
500,000. House and close.
Page 9 is a new decision item.
House and close.
Page 10 is a new decision item.
Let's go with the governor on that one and close.
Page 11, new decision item.
Governor and close.
Page 12 was one timed last year.
Yeah, go with the house and close.
I'm on 12. I believe there is a request for the Public Safety Child Care Center on the Boone County campus for $2.5 million.
Got it. That was at the bottom of page 12. $2.5 million?
Yes.
Yep. And close that one. 13.
Page 13, there's no changes to the core.
Let's go with the house and close.
An additional NDI for request for grants for drug dogs for $750,000.
Yep. And close that one.
Page 14, no changes to the core.
House and close.
Page 15, no changes to the core.
House and close.
Page 16, no changes to the core.
House and close.
Page 17, no changes to the core.
School safety apps, house and close.
Page 18, no changes.
House and close. You on 19, Sarah?
Page 19, the
Yep.
water safety program.
Let's take a Senate position at 300,000.
An increase to 300,000.
Mm-hmm.
Okay, got it.
And close it. Page 20.
Page 20, no changes to the
Products,
core.
House and close.
Page 21, no changes to the core.
Then 988. Yep. House and close.
Page 22, no changes.
House and close.
Page 23, no changes.
House and close.
Page 24, no changes.
House and close.
Page 25, no changes.
House and close.
Page 26,
Smart,
no
house and
changes.
close.
Page 27, no
House.
changes.
Close.
Page 28, no changes.
House and close.
Page 29, no changes.
House and close.
Page 30, no changes.
House and close.
Page 31, no changes.
House, close.
Page 32,
No
no
changes.
changes.
House and close. Witness
Page
protection, house and
33.
close. Forensic house
Page
and
34.
close. 35.
Page
Forensic labs,
35.
House and close.
Page 36, no changes.
Yep. House and close.
Page 37, no changes.
Post training, house and close.
Page 38, no changes.
House and close.
Page 39, no
Capitol Police,
changes.
house and close.
Top
Middle
of page
40.
40 is an NDI that the governor and House did not recommend.
Go with the house, that's fine.
And the
Close.
middle of the page is an additional NDI for cellular phones for
Yep,
sworn
house
staff.
and close.
Page 41, there's no changes to the core.
House.
The bottom
Opposed?
of page 41 to the top of page 42 is an NDI for an FTE transfer.
Yeah, I've got a Senate position here and increase the PS line by 65,378 and 1 FTE. Is that what you've got?
Yes.
Perfect.
And
close.
the middle of that page is another NDI for
Yeah,
a
go with the
preschool
House on
program.
that other NDI.
Page 43, no changes to the core.
House and close.
Bottom of the page is an NDI for fringe benefits.
Yep, House and close.
And the top of page 44
44
is another NDI.
House and close.
Page 45, there's no changes to the core.
House and close.
On page 46, the middle of the page, there's an NDI not recommended by the House or the Governor.
That's fine. Go with the House and close.
The bottom of page 46, top of page 47 is another NDI.
Yeah, let's take a Senate position here, an increase of $7,252,954 for a total of $8,752,954.
Got it.
Thank you. And close
The
it.
middle of the page there is another NDI not recommended by the Governor or the House.
House and close.
Top of 48, NDI not recommended by the Governor of the
Yep.
House.
House and close.
Middle of the page is an NDI for fuel and expenses.
Yep. House and close.
Bottom of page 48, top of page 49 is an NDI for specialized equipment.
You're on 49, top of 49.
Yes.
Go with the House and close on that one. I think we've got one other NDI at the bottom of page 49 for the cannabinoid enforcement, right?
Yes.
2 million.
Yes.
And close.
Page 50, there's no changes to the core.
House and close.
Bottom of page 50, top of page 51 is an NDI for a boat replacement.
House and close.
Page 52, no changes to the core.
House, close. Vehicle replacement on
Page
53.
53, no
House
changes.
and close.
Middle of the page, NDI not recommended by the Governor of the House.
House and close.
Bottom of page 53, top of page 54 is an NDI for a Bearcat replacement.
House and close. Crime
Page
Labs on
55, no changes.
House, close.
Top of page 56 is an NDI for case management.
Go with the House and close.
Middle of the page, NDI not recommended by the Governor of the House.
House and close.
As well as the NDI on the bottom of page 56, top of page 57.
Yep, House and close.
Page 58 is an NDI recommended by the House.
Yeah, go with the Governor on that. And close.
Page 59, there's no
Jason.
changes to the core.
Yep, House and close.
Page 60, no changes to the core.
House and close.
Page 61, no changes to the core.
House and close.
Page 62, no
No
changes to the
changes. House
core.
and close.
Middle of page 63 is an NDI, expungement processing unit.
Yep, House and close.
Bottom of page 63, top of page 64 is a NDI for cell phones.
House and close.
Page 65, no changes.
House and close.
Page 66 is an NDI recommended by the House.
Go with the House on that. 250,000 mental health stuff. Yep, House and close.
Page 67, no changes to the core.
Go with the House on 67. That finishes
That
book
concludes
one.
book one.
Whenever you're ready.
Book two starts on page 68 with alcohol and tobacco control. There's no changes to the core.
House and close.
The bottom of page 68 to the top of page 69 is an NDI for additional 2 FTE.
Yep, go with the House. Close.
Page 70, there's no changes to the core.
House and close.
Page 71, no changes to the
House
core.
and close.
Top of page 72 is an NDI not recommended by the Governor of the House,
Go with the House.
as well
Close.
as the middle of the page.
Yep, House and close.
Bottom of page 72, top of page 73 is an NDI for spending authority increase.
Go with the House. And then I've got a handful of NDIs in this section, Sarah. Let's see, we got the City of Gideon Fire Station at 100,000, Eminence Fire Station 2 million, additional inspectors in the Boiler Inspector Division at 230,000. The Critical Illness Pool for PTSD, I think that was actually passed last year. Legislation 4 million. We'll use opioid funds on that. And then the last one I've got is grants for some volunteer firefighters to be included in the critical illness pool at $750,000, right?
Yes.
Mr. Chair.
Senator Washington,
Yeah,
how
I
are
had
you
to-
this morning?
I'm doing well. I just wanted to point out that we did have a conversation about the Raytown Fire Protection District for $100,000, but we weren't able to fund that this year, correct? Thank you.
And we'll close page 73. Thanks, Sarah.
Page 74, there's no changes to the core.
House and close.
Page 75, no changes to the core.
House and close.
Middle of the page is an
Training.
NDI.
Yep, 20, house and close.
Page 76, no changes to the core.
House and close.
Middle of the page is an NDI not recommended by the Governor of the House.
House and close.
Bottom of page 76, top of page 77 is an NDI, contracted cemetery grounds.
Yep, house and close. Then I've got a new NDI at the bottom of page 77 in St. Louis Veterans Home van. Is that right? Is that 180,000? Okay. I didn't have a number on that, but yep, 180,000. Thank you, Sarah, and we'll close that.
Page 78, there's no changes to the core.
House and close.
Okay, the middle of the page is an NDI for the Veterans Community Project.
House and close.
Page 79 is an NDI recommended by the House.
Grant. House and close.
Page 80 is a World War I memorial.
Yeah, go with the governor on page 80 and
In the
close.
middle of the page is an NDI.
Same, go with the governor. Close.
Page 81, no changes to the core.
House and close.
Page 82, no changes to the core.
House and close. Veterans Homes on
Page
83.
83,
House
no
and
changes.
close. Top of 84.
It's an NDI,
Yep.
the Veterans Home PS
Yeah,
Authority.
go with the house. And close on that one.
Page 85, no changes to the
House
core.
and close.
The middle of the page is an NDI not recommended by the
Same,
Governor of
go
the
with
House.
House.
Page 87, no changes to the core.
House and close.
Page 88, no changes to the core.
House and close.
Middle of the page is a solvency transfer.
Go with the governor on that one. Senator May, what do you got? Senator May, is your microphone on? We've got some other members of the committee I'm sure would love to hear this conversation.
Just between us. So no, I'm just making sure that this is the, I know they requested, is this bringing it to the 39? It's actually more, so that's the 40,529,000 we're going with the House on?
On the core is
Yeah, on the
40
core,
million,
Senator,
529.
yes.
Okay. I think that's it. I'm not sure, but I'm,
All right.
That takes us to page 90.
90, yep,
No changes to the core.
yep. House and close.
Page 91, no changes to the core.
House and close.
Middle of the
County
page is an
Commission.
NDI.
Yep, go with the house on that.
Page 92, no changes to the core.
House and close.
Page 93, no changes to the core.
Bingo division, house and close.
Page 94, no changes to the core.
House and close.
Page 95, no changes to the core.
All right, house and close.
Page 96, no changes to the core.
House and close.
Page 97, no changes to the core.
House and close.
Page 98, no changes to the core.
House and close.
Page 99, no changes to the core.
House and close.
Page 100, the
What
House
change on-
added 155,000. This is SEMA.
Page 100. Yep, go with the house.
Bottom
And-
of that page to the top of page 101 is an NDI not recommended by the Governor of the House.
Yeah, go with the house.
Middle of the page is an NDI for MRC Strong,
House and close.
followed by the play plan. Page 103 begins the National Guard, which was moved so we can make a
Right.
global decision on all these sections. Let's go with the House.
Go with the house, and then for the benefit of everyone following along, we can skip right on up to page 113, I believe,
That's
right?
correct.
Because that whole division's moved.
Page
all right.
113 is Task Force 1 funding. There's no changes.
House, close.
Middle of the page is an NDI for equipment.
House and close.
Bottom of page 113 to 114 is an NDI for large-scale exercise.
House and close.
Page 115, the House reduced by 155,000.
Go with the house. That's fine. And close.
Page 116, there's no changes to the
Senior
core.
grants, house and close.
Middle of the page is an NDI for
All right, next up, I've got the Department of National Guard, right?
Yes.
Is that where you are?
Yep, we're going to
All
start
right.
on page 1. There's no changes to their
To the core,
administration
go with the
core.
House.
Middle of the page is an NDI not recommended by the Governor of the House.
House, close.
Top of page 2 is another NDI not recommended by the Governor of the House.
Yeah, we'll go with the House. This is usually where people make a joke about having to, go check it out because it's in France, but we're just going with the House here.
Middle of the page is an NDI for an employee
Yeah,
request.
go with the House.
Followed by the pay plan.
Yep, House.
Page 4 is an NDI recommended by the House.
We'll go with the House on that.
Page 5
Close.
is an NDI recommended by the
Yep,
House.
go with the House. Close.
Page 6, there's no changes to the core.
To the core, go with the House. Then I've got an NDI tuition reimbursement at $1 million on the bottom of the page, right?
Yes, that's correct.
Bottom of page 6, NDI, and close on that one. Thank you, Sarah.
Page 7, there's no changes to the core.
Go with the House. Thank you.
Page 8, no changes to the core.
Yep, go with the House. Close.
Page 9, the House increased by $45,000.
Go with the House. Close.
Middle of the page is an NDI for field support
Yep,
utilities,
House and close.
followed by the pay plan.
Yep.
Page 11, there's no changes to the core.
Armory rentals, House and close.
Page 12, no changes to the core.
Go with the House and close.
Page 13, no changes to the core.
Go with the House and close.
Page 14,
Contract
no
services, House
changes
and
to the
close.
core.
Middle of the page.
Middle of the page is an NDI.
After House and close.
Bottom of page 14 to the top of page 15 is an NDI,
Yep, go with the House on that one and close.
followed by the pay plan.
Yep,
Page 16, there's no changes to the core.
House and close.
Middle of the page is an NDI for radio request.
House and close. And legal expense.
Page 17 is legal expense funds.
House and close. Next up, I've got corrections.
That's correct.
House Bill 2009.
Page 1, we're
Yep.
going to start with the Office of Director Staff. There's no changes to the core.
House and close.
Page 2 is mileage. It's no longer needed.
Go with the House and close.
Page 3 is the pay plan. That's no longer needed.
All right, go with the House. Then I've got a new section on the bottom of page 3, 9009, crime victim notification software at $3.5 million, right?
Yes.
And close it. Thank you.
Page 4 is no changes to the core.
Go with the House on the core.
The middle of the page is an NDI that's going to hit several sections, so we can
Correct.
make a global decision on
Correct.
it.
Let's go with the governor. Go back with the governor's recommendation on 4. Middle of page 4.
Middle of page 4, that's correct.
And then, let's see. Well, I mean, we're going to end up doing, pay plan adjustments because of the reallocation of that.
That's correct. We are going to reallocate funds from each institution into this section to create a centralized special investigations unit. To do that, we will have to also take a Senate position on all of the institutions and the pay plans, as well as the pay plan in this section.
Sounds good. And close on page 4. Thank you, Sarah.
That takes us to page 6. There's no changes to the core.
House and close.
Middle of the page is an NDI.
Yeah, go with the House. Close.
Top of page 7 is the core for the KC reentry program. There's no changes.
Yep, House and close.
Page 8 is federal and other programs. The House reduced this by $1.4 million.
Go with the House. Close.
Page 9, there's no changes to the core.
House and close.
Page 10, no changes to the core.
House and close.
Page 11, no changes to the core.
House and close.
Page 12, no changes to the core.
House and close.
Page 13, the House reduced by about 40,000.
Go with the House. It's fine. Close.
The bottom of page 13 to the top of page 14 is the NDI for that 40,000.
Staff- Yeah, House and close.
Page 15, there's no changes to the core.
House. Close.
Page 16, no changes to the core.
House and close.
Page 17, no changes to the core.
House and close.
Page 18, no changes to the core.
Go with the House.
The middle of the page is the NDI we took the global decision on. That
so
would be
that's back to
governor.
the governor. Yep.
Page 19, no changes to the core.
House and close.
Page 20, no
overtime,
changes to
House
the
and
core.
close.
Page 21 is the institutional E&E pool. We'll have to take a Senate position here for the special investigations unit we created
Got it.
earlier.
Perfect. Middle of the page.
In the middle of the
21.
page is the governor.
Yeah, go back to the governor. Yep.
Page 22, there's no changes to the core.
House and close.
Page 23, no changes to the core.
House, close.
Middle of the page will be governor.
Yep.
Page 24 begins the institutions. This is where we'll have a Senate position on all the institutions and the pay plans for that Special Investigations Unit.
Right.
However, there are 2 NDIs within the institutions.
Okay.
So if we go to page 25, the middle of page 25 is an NDI for the prison nursery. The House reduced this, and on page 27, created a new section for
Right.
it.
So it's not gone, it's just moved.
Yes.
So we can take the House position in the middle of 25, and then you'll see it again on 27.
That takes us to page 27.
Sorry, Senator, you say the top of 25? That was a Senate position at the top, House position in the middle, and then, like I said, you're going to see that prison nursery line moved to page 27, which is where we are now. Top of 25, Sarah.
We're going to reallocate an FTE and their PS to the new Special Investigations Unit. And that will be throughout all the institutions.
Thank you, Sarah. 27.
Page 27 is the prison nursery program.
Right. So go back to the House there.
That takes us to page 46. The House reduced by about 198,004 FTE for an NDI at the bottom of page 46.
Go with the House.
And then you'll see the NDI there at the bottom of 46, top of page
Right.
47.
So, House position there also. 48.
Page 48, there's no changes to the core.
House.
Page 49, no changes to the core.
House and close.
Page 50,
Drug
no
testing,
changes.
Toxicology, House and close.
Page 51, there's a difference of about 36,001 FTE for the NDI on the bottom of page 51, the top of page
Right.
52.
So we'll make that Senate position there.
We'll take a Senate position to reallocate $1
Yep.
from PS and E&E. And we will leave the House position of the reducing by 36,001
Correct.
FTE for the NDI.
Got it.
And then on page 52 for the NDI, we'll take
So,
the House.
yeah, take the House at the top of 52. 53.
53, no changes to the core.
House and close.
Page 54, the House reduced by about 158,003 FTE for an NDI.
Right. House, close.
Middle of the page is the governor.
Right. Go back to the governor globally. Yep.
And then on the middle of page 55 is the reduction the House took,
Right. Go with the House.
as well as
At the bottom of the page
bottom of page
also, yep.
55, top of
PS
page
follow it,
56.
yep. Transition Center in St. Louis. Go with the House on the top of 57.
58
People
is the
in.
same.
Same deal. House.
Bottom of page 58, top of page 59 is the NDI.
Yep. House and close.
Page 60, there's no changes to the core.
House, close.
Page 61, no changes to the core.
House and close.
Page 62 is no longer needed.
Okay. House and close.
Page 63, there's no
Monitoring.
changes.
House and close.
Page 64,
Supervision Centers. House
no
and close.
changes. The middle of that page for the
Go
NDI
back
will
to
be
the
governor.
Pay plan. 66.
66,
board.
there's no changes to the
Yep.
core.
House and close.
67, no changes to the core.
67, top of the page. Go with the House on that, and then I want to send a position for county jail reimbursements, middle of the page. We're just going to double what the House did and make it 10 million instead of 5. 68. And
Page
close that one.
68, there's no changes to the core.
House and close.
Page 69, no
Canteen
changes to
fund,
the
House and
core.
close.
Page 70, no changes to the
Settlement,
core.
House and close.
Page 71 is the legal expense
Yep.
fund.
House and close. Thanks, Sarah. You ready, Taylor?
Hope so.
Excited?
Yep.
All right. House Bill 10, Office of the Director, Book 1 of 3. Whenever you are ready.
Page 1, Director's Office, no core changes.
House and close.
Page 2, mileage reimbursement, this
House
is
and
no longer
close.
needed. Page 3, pay plan, no longer needed.
House and close.
Page
Overtime.
4.
House and close. Contracted staff. House and close.
Page 6, operational support, no core
House and close.
changes. Bottom of page 6, top of page 7, employee support
Yep.
resources.
Go with the house and close.
Bottom of page 7, attorney
Yep.
contract.
House and close.
Page 8, COVID crisis
Go
counseling,
with
no
the
longer
House.
needed.
Yep.
Page 9, SAMHSA COVID-19 grant, no longer needed.
House and close.
Page 10, staff training, no core changes.
House and close.
Page 11, employee support resources.
House and close.
Page 12, refunds,
Refunds. House and close.
and bottom of
Refunds
page
increase.
12.
Yep. 250,000.
Page 13
Yep.
is
House
the
and
debt
close.
offset.
House and close.
Page 14, abandoned fund transfer, no
House
core
and close.
changes. Page 15, mental health trust fund, no core changes.
House and close.
Page 16, federal funds, no core changes.
House and close.
Page 17, housing assistance, no longer needed.
House and close.
Page 18, intergovernmental transfer.
Transfers. House and close.
Page 19, GR transfer for state match.
On the core, go with the house.
Bottom of page 19, chip transfer, cost to continue.
Yep, go with the governor, and then I've got an NDI CCBHO earnings to GR transfer, 50,843,760. Is that right?
Yep.
Fed fund, what, 0148?
8, yep.
Okay, perfect.
Page 20, IGT Medicaid transfer.
House and close.
Page 21, DSH transfer to GR.
House and close.
Page 22, federal earnings fund transfer, no longer needed.
Yeah, go with the house. Then I got a couple of new sections. 10092 NDI for the SWOPE health improvements, 1.5 million. Let's do GR on that one. And then 10093 North Kansas City Hospital improvements, 15 million. We can do GR on that one also. 10094, the Samuel Rogers Pediatric Wing, 2.5 million. Do budget stabilization on that one. And the last one I've got, Taylor, is 10095, the C-Star provider in St. Louis Stabilization Center at 250,000.
Yep.
My notes match yours.
Mhm.
Everybody good? Wonderful. And close that. 23.
Page 23, Jewish Federation, no longer needed.
House and close.
Page 24, mental health hospital, no longer needed. That's the end of book
Little,
1.
that little $300 million line from last year. Right, Val? No longer needed, but very much needed.
Book 2,
Book two.
Department of Mental Health, page 25, there's a reduction here of 76,500.
Go with the governor.
Page 26, Mental Health Administration.
House and close.
Bottom of page 26, top of page 27, Admin Billing Services Review, new decision item.
Yep, go with the house there. And then I've got a new decision here for behavioral health grants, 150,000 and 2 FTE, same Fed fund as before, 0148, right? Perfect. And
Page-
close on 27. 28.
Page 28, Substance Use Disorder Prevention and Education Services.
House and close.
Top of page 29, Substance Use Prevention Youth.
House and close.
Page 30, Mental Health Prevention.
House and close.
Page 31, Opioid Community Grants.
Let's see. I think we've got a Senate position here. Just reducing the 220,000 in other funds on that line. Is that right?
Yep.
So total on that would be a Senate position, 6,044,000.
Yep.
Right? Okay. And
Bottom of
close
pa-
on that one.
Bottom of
Opioid
page 30,
settlement. Go with the house on that. Gets us to 33.
Heartland Center, new
Yep.
decision
House
item.
put in $636,000 for Heartland. Yeah, that's fine. Go with the house. 34.
Page 34, Capstone Group, 220,000, new decision item put in by the House.
Well, House is just spending money, aren't they? Go with the house. 35.
Page
Oh, there's
30.
another one. Here's $1 million. Go with the house. Man, they should be happy.
Page 36, Opioid Settlement Administration.
Another house edition. Go with the house.
Page 37, recovery support services, 1.8 million.
That's fine. Go with the House. And I've got an NDI, peer-to-peer substance and mental health services at $100,000. Right, Taylor? And close. 38.
Recovery
More money
community
added by the
centers.
House. $4.4 million. Go with the House.
Bottom of page 38.
You getting all this, Rudy?
Increase.
Okay. There's another $1.2 million addition from the House. Go with the House.
Top of page 39.
$3.2
recovery.
million added by the House. Go with the House.
Page 40,
Hope
substance
nobody's
use
tracking
disorder
this.
treatment services, 130.4 million.
Yeah, let's take a Senate position here. You're on the top of 40, Taylor?
What?
Where are you? Are you on the
Yeah,
top
top
of
of
40?
40.
Okay,
Yep.
good. Take a Senate position, add $2,996,592 in GR and $3,666,445 in Fed. Am I right?
Yep.
Okay. Thank you.
Bottom
Bottom
of
of
page 40 is located in multiple sections. Do you want to take a global stance?
Yeah, just take a global, we're going to go back with the governor on this. Bottom of 40, taking a global position, taking the governor's rec.
Yep.
And we'll mention them as we go through. But, yep.
Top of page 41, recovery community centers.
Top of 41,
This
House.
Was, yep, this was, okay.
Yep. House
Middle
and
of
close.
page 41, recovery support services
Same.
rate alignment.
House and close.
Bottom of page 41, top of page 42, addiction fellowships.
House and close.
Middle of page 42,
Opioid overdose.
Yep.
House and close.
bottom of
43.
page pay plan.
Yep.
Middle of page 43 is the FMAP.
Yeah, again, we can kind of take a global position here, can we not, and go with the House? Yep.
Bottom of page 43, top of page 44, opioid treatment expansion.
Yeah, let's take a Senate position here and add $2 million in opioid funds, bringing the total to $7,993,184. And close that one.
Bottom of page
Recovery High
44. This is into a new
House
section.
and close, and then let's do a new section here. 10110 DMH housing liaisons at $1 million. Choose. Let's make that. Let's make it 3.
The
out of-
remaining is in a different section.
The other
Ju-
4
yeah,
million's in
yeah,
another
it's in a
section?
different-
Okay,
different section,
perfect.
yeah.
So we'll leave this one at $1 million GR and close on that one.
Page 45, substance use disorder naloxone supply,
Yep,
no
house
core
and close.
changes. Bottom of page 45, naloxone saturation, house and cover the same.
Yep, house close.
Page 46, mental health community program, 143 million.
Right, let's go with Senate position, put $2 million of federal funds back in there, making that line $144,549,837.
Bottom of page
Close.
46, federal authority 988 grant cost to continue.
Yep, go with the house and close.
Increased medication costs, top of page 47 was Gov.
Yep,
Middle of page
Governor.
47, civil commitment legal fees cost to continue.
House and close.
Bottom of page 47, top of page 48, children's hospitalization report.
House and close.
Bottom of page 48, top of page 49 is FMAP for the House.
Yep, go with the house on that. And then I've got a couple of NDIs here. DMH, this is, Senator Arthur, this is the other portion of your $5 million line. So we've got DMH housing liaisons, $4 million. And then we've got, let's see, an NDI 10110, law enforcement, jail, let's see, healthcare hub at $375,000. Is that right, Taylor?
Mm-hmm. Yep.
Then we've got BHDD residential alternatives, 2 new sites in Como and St. Louis, 913,000 GR, $2,868,008 in Fed funds. And then the last one I've got is the PTSD for EMS at $1 million out of GR. Right?
Yep.
Perfect.
Page 50.
Close on those and go to 50.
Page 50, youth community programs. Gov and House are the same.
Go with the house. Close.
Bottom of page 50, perinatal psychiatry access program. This was moved to a new section.
Okay, go with the house.
Page 51, SATOP, no longer needed.
House and close.
Page 51 through 57 were reallocated or reduced and are no longer needed. Do you want
Right.
to take a global position?
I can say house pretty quick. Let's go. 52, house. 53, house. 54 would be the house. 55 would be the house. 56 would be the house. And 57. House and close on all
58,
those. Thank you.
988 grant.
Yep. Go with the House and close.
59, FQHC mental health services.
600,000. House and close.
60, behavioral health transports, 5 million.
Yep.
No
Go
more
with
changes.
the House on that, and then I've got an NDI for health transports increase 4 million GR. Is that what you've got?
Yep.
Perfect.
Page
Close
61.
on that one.
ETMS PTSD.
House and close.
Bottom of page 61, ETMS PTSD increase.
We'll take a Senate position, add 2,884,595 in federal, bringing that total to 4,234,595.
Yep.
Sound good on the end? Wonderful. Thanks, Senator.
Probably the most important thing you're doing.
We're losing control here. What?
Probably the most important thing you're doing.
I know. You're welcome.
In Senator Arthur's district.
All right, we're done on 61. 62.
62, Burel behavioral health. 1.14 million.
Take a Senate position at 0.
Page 63, doorways.
Senate position at 750,000.
Page 64, addiction fellowships,
House
1.3
and
million.
close.
Page 65, civil commitment legal fees.
House and close, middle of the page, CTC, House and close. Recovery High Schools, go with the House. That's a $10
Page
billion
67,
house.
psilocybin research grants.
Governor, and close on 67.
Page 68, CCBHO substance use disorders.
Take a Senate position, let's see, 51,813,667, is that right, Taylor?
Yep.
Okay, thank you.
Middle page 68, CCBHO MEI GR pickup.
Yep, go with the House on that.
Bottom of page 68, top of page 69, CCBHO MEI.
Yep, go back with the Governor.
Bottom of page 69, FMAP.
House and close, and I've got a new decision ICCBHO GR pickup for the ending of that at 4,307,381 general revenue.
Yep.
Thank you. And close. 70.
Page 70, CCBHO mental health, 393 million.
Let's take a Senate position of 356, 015, 416
Middle
total. Yep. Thank you. And middle of the page.
70, CCBHO
Pickup.
MEI.
Yep. House and close.
Bottom of page 70, CCBHO MEI, and top of page 71.
Go back with the Governor on that one.
Middle of page 71, federal authority,
Yep.
CCBHO providers.
That shows up. Governor and close.
Bottom of page 71, top of page 72.
FMAP, House.
Middle of page 72, BHCC operations.
Let's take a Senate position, add 1,612,906 GR and 5,066,586 Fed on that line. Good?
Yep. On
All right.
top of the governor recommendation.
Correct.
Yep. Bottom of page 72, top of page 73, BHDD residential alternatives.
Go with the Governor there. And then I've got a couple of NDIs here. 10115, Innovation and Behavioral Health Model Grant, 2,850,000 Fed funds. Same section, Law Enforcement Jail, CBHL, Rural CBHOs. Let's see, totaling 500,000, but it's 118,975 and $381,025 at federal, right?
Yep. Yep.
And then the last one, the GR pickup for those CCBHOs for that funding ending is $4,307,381 in general
Gee.
revenue.
Yep.
All right, cool.
Page,
And close on 73, 74.
CCBHO youth community programs.
Let's take a Senate position here. Be the total line of, let's see, 137,669,384.
Middle page 74, CCBHO MEI
Yep.
GR pickup.
Go with the House on that.
Bottom of page 74, top of page 75, DMH utilization.
Let's take a Senate position here, totaling 13,293,722.
Yep. Middle of page 75, CCBHO MEI.
Governor.
Bottom of
Close.
page 75, top of page 76, federal authority, CCBHO
Yep.
providers.
Go back with the Governor on that one.
Bottom of page 76, FMAP.
FMAP. House. And then I've got a couple of NDIs here. Let's see, BHCC operations totaling $2,226,508. And then another one, CCBHO's GR pickup, again for that funding ending at $9,735,481 in general revenue. That would close page 76.
Perinatal Psychiatry Access Program,
Put the house on that.
$750,000. Page 78, 988 Crisis Response
Yeah,
Admin.
the House put a one-time designation on that. We're just gonna take a set of position, leave the money and take the one-time designation off. Thank you, Taylor.
Page 79.
Same on the next one, tied together. Send a position, remove the one-time.
Page 80, MoConnect Crisis Module, $500,000.
Well, it's $498,750,
Yep.
but, you know, we'll take the House on that.
Page 81.
Same number there, 81, House and close.
Page 82.
$1 million, substance abuse, House and close.
Page 83, Forensic Mobile Teams.
Let's take a Senate position totaling $1,858,506 on that top line, on the forensic mobile teams.
And
Close that one. Go ahead.
Middle, page 83, Forensic Mobile Teams.
Go with the House on that. And then we've got an addition in 10-121, adding those DDs at $46,992 general revenue for PS, and then a new section underneath that for the statewide, let's see, subdata analytics platform at $1.3 million out of opioid funds.
Yep.
And that'll close 83.
Page
84.
84, Epic, $500,000.
Yep. House and close.
Page 85, Facility Support.
House and close.
Bottom of page 85, Safety and Security Replacements, $2.25 million. Gov and House are the same.
Yep. House and close.
Page 86, University Health, no longer needed.
Doing three things at once. Yep, you're right. House and close.
Page 87, Recovery Lighthouse. This was a one-time reduction.
Yep. House and close. And then I've got an NDI underneath there, section 10125 for Recovery Lighthouse at 980,000 opioid funds.
Yep.
On my notes. All right. Thanks, Taylor. 88.
Patients post-discharge, $2 million.
House and close.
Page 89.
Senator May,
Fulton-
you got a question?
I'm gonna use my microphone. So can we add a new section 10.129 for live sober living for women? It's 1.5 million. I think that Senator Roberts had a discussion about it. It's a recovery center.
You want the long answer or the short answer?
I want the 1.5 million.
Yeah, the
I
short
hope that's
answer.
a
The short answer is no. I think we're in a pretty good place. I've worked with Senator Roberts on a number of other items in the budget, and that's one of them that didn't quite make the cut. But I appreciate you bringing it up.
It's an excellent recovery system. I appreciate it. Thank you.
No problem.
Page,
Go ahead, Taylor.
Page 89, Fulton State Hospital, no core changes.
House and close.
Middle of page 89 is...
That's another one of those global decisions, isn't it,
Yes.
Taylor? We go with
Yep.
the governor. Go back there. Yep.
Bottom of page
Thank you.
89, top of page 90, increased medication costs, which was the global.
Governor.
Top of page 91, DMH contracted staffing costs to
Again, kind of
continue.
global decision there. Go with the House.
Okay.
92.
Page 92, Fulton State Hospital facility overtime, no core changes.
House and close.
Page 93, Fulton State Hospital sorts, no core changes.
House and close.
Middle page 93, environmental goods, that was the global for Gov. Page 95, Northwest Missouri Rehab Center, no core changes. Middle
House and close. Sorry, Taylor.
of page
Yep.
95,
Governor.
environmental goods. Bottom of page 95, top of page 96, increased medication.
House and close.
Top of page
99.
97, contracted staffing costs to continue.
House and close.
Page 98, Northwest Missouri Rehab overtime, no core
House
changes.
and close.
Page 99, Forensic Treatment Center.
House and close.
Middle page 99, environmental goods.
Governor. Close on that one.
Bottom of page 99, top of page 100, increased medication
Yep.
costs.
Go back to the governor on that one.
Middle of page 100.
FTC, house and close.
Middle of
101.
page 101, DMH contracted
Contract and
staffing.
staffing, house and close.
Page 102, SEMO Mental Health Center.
Go with the house and close.
Middle of page 102, environmental goods.
Governor on that one and close.
Bottom of page 102, top of page 103.
Governor there.
Middle of page 103,
Mobile
forensic
teams,
mobile teams.
house and close.
And bottom of page 103, top of page 104 is a pay plan.
Ah, yeah, well, that's where we go back, Senate position, totaling $2,432,871, right? Okay,
Yep.
Perfect.
And that was moved to the forensic mobile
Right.
teams on a different section.
105,
SEMO overtime, no core changes.
house and close.
Page 106, SEMO sorts. Gotta be plus the house.
Yep,
Middle
house
of page
and close.
106.
Go back to the governor there.
Bottom of page 106, top of page 107, SEMO Mental Health Center jail contract.
House and close.
Bottom of page 107, top of page 108, SEMO Mental Health Center Safety and Security.
Yep, house and close.
Page 109, SEMO sorts overtime, no core changes.
House and close.
Page 110, Center for Behavioral Medicine.
House and
Difference.
closed. Governor on the middle of the page.
Bottom of page 110,
Top of
page
11.
111.
Yep, governor also. And then middle of that page on the pay plan, go back to the Senate position totaling $1,120,160.
Yep,
Again, for those forensic mobile teams.
yep.
Thank you, Taylor.
Top of page 112, Center for
It's
Behavioral
all the
Medicine.
same, house and closed.
Page
Gotcha.
113, Hawthorne's Children's Psychiatric Hospital, no core
House,
changes. Middle of
close.
page 113,
Go back to the
environmental
governor
goods.
there.
Bottom of page 113, top of page
Same,
114. Top of page 115, contracted staffing.
House, close.
116, Hawthorne Children's Psychiatric Hospital overtime.
House and close.
That is the end of book 2.
All right, I'm on book 3.
Okay, book 3, DD admin, no core changes.
House and close.
Bottom of page 117, top of page 118, licensure and certification increase.
Go with the house.
Page 119, DD admin, Medicaid.
House and close.
Middle of page 119, environmental accessibility adaptation.
House and close.
Page 120, reimbursement allowance, no core changes.
House and close.
Page 121, HAB center payments, no core changes.
House and close.
Page 122, state waiver programs, no longer needed.
House and close.
Page 123, DD community programs.
Go back with the Senate position here, adding $64,335,000 in federal, so that would be a total of $2,285,000 or $2,285,200,234, right?
Yep.
Okay.
Bottom of page 123, DMH utilization.
Governor, close.
Top of page 124, DDH CBS enhancements, cost to continue. This was recommended in a new section.
Yeah, top of 124, house and close.
Bottom of page 124, DD Missouri Autism Centers.
Yep, go with the house on that.
Top of page 125, DD Community Transitions Pilot.
Am I the only one that just heard chimes? Yeah. Uh-huh, great, well, just making sure. Let's see, if we're on the top of 125, Taylor, I've got a Senate position with Fed at $6 million, is that right?
Yep.
Okay,
Middle of page 125, DD Increased Authority CD Fund.
go with the house.
Middle of page 126, FMAP.
House.
Top of page 127, LTC Career Path Platform.
Yep, go with the house on that one.
Bottom of page, or middle of page 127, Assistive Tech, VBP incentives.
Yep, go with the house on that. And then I've got two new NDIs in the same section, 10-410, DD community providers, rate increase with also that shift differential that we talked about, totaling $171,400,000. And then the DD day have rate increase. He's not here either. Totaling $9,432,860.
Yep.
All right, Taylor. All right, and that'll close 127.
Page 128, Rolla Autism Center, no longer needed.
Go with the House and close on that.
Page 129, no core
Outreach
changes.
initiatives, House and close.
Page
Autism regional
130, no
projects,
core
House and
changes.
close.
Page 131,
Research, House and close. Middle of the page.
131, Autism Research Grant.
No, House added. We just did your Dayhab stuff. House, you're welcome. House and close on their 5 million. Yep,
Page
132.
132, DT Train.
all the same.
Yep.
House and close.
Page 133, Joplin Autism
Not needed
Center.
anymore. Did that last year. House and close.
Middle of page 133, Joplin Autism Center, a new decision item. Oh,
No, you're good. I'm just looking at you. That's fine. Go with the House. Give them another 5 million on that.
page 134, Springfield Autism Center.
House and close.
Middle page 134, Springfield
And then my
Autism
town
Center.
only gets 2. That's weird. Okay. House and close on that.
Page 135, DD Health Home.
House and close.
Middle of page 135, DD HCBS Enhancements Cost to Continue.
Yep. Go with the House. A little over 8 million.
Yep. Page 136, Patients Post-Discharge, no core changes.
House close.
Page 137, St. Louis County Autism Center, no longer needed.
House and close.
Page 138, no longer needed.
House and close.
Page 139, Community Support Staff, no core changes.
House and close.
Page 140, DDA, no core changes.
House and close.
Page 141, Provider Tax Transfer from other funds to GR, no core
Yep.
changes.
House and close.
Page 142, Provider Tax Transfer from GR to other funds,
House
no
and
core
close.
changes. Page
Top of 143.
So page 143 through page 166 are centers and facilities. Do you want to take a global stance on that? We've got the goods and services increase, which we've said was Gov, pay plan house, contracted staffing house.
Yeah, that's fine.
Okay,
Yes.
and then there's a new decision item, page 149, 153, 157, 159 for the DD federal match adjustment, which the Gov was equal to the house. So do you want to take
That
the
works.
house?
Yep.
Okay,
Yep,
go
it's
to
fine.
page 166.
Thank you, Taylor. So we got fast forward to 166, everybody.
Page 166 is no core changes.
Go with the House.
Page 167 is
Legal
the
expense
legal
fund.
expense. Yep.
House and close. Need to stretch? Yeah. It was a compliment. He came to the office. He came to the office. No. Good? Nah, he was. You ready, Taylor? We are going to be. We're going to be in book one. Department of Health and Senior Services. 1 and 2. These are the last two, and then we'll break for. Which should be a very short session. All right, Eric. All right, I am on book one, or in book one of two for the Department of Health and Senior Services. Intention would be to get through these last two books, and then we'll take a break for what should be a very short session. Right? All right, Taylor, whenever you're ready.
Page 1, Office of the Director, no core changes.
House and close.
Page 2, Program Operations and Support,
House
and Govern
and
the
close.
same.
Thank you.
Top of page 4,
3.
Disease Intervention Specialist.
House.
Or top of page 3, sorry.
Yeah, top of page 3. Yeah.
Middle
House
of
and
page
close.
3,
Thank you.
Building HCBS Capacity.
House and close.
Bottom of page 3, top of page 4, Legionella Program.
House and close.
Middle of page 4, Supplemental Health Care.
House and close.
Bottom of page 4, top of page 5, HCV Testing.
House and close.
Middle of page 5, Erase Maternal Mortality.
House and close.
Bottom of page 5, top of page 6, Alzheimer's Appropriation. Gov and House are the same.
Wait 2 seconds.
Yep.
Go ahead, Taylor.
Bottom of
Where?
page 5, top of page 6, Alzheimer's Appropriation.
House and close.
Middle of page 6, Environmental Health Services.
House.
Gov and House are the same.
House
Bottom of
closed.
page 6, top of page 7, Increased Nutrition Specialist. House and Gov are the same.
House and close.
Middle of page 7, Safety Grant.
House
and
and
Gov are the
closed.
same. Bottom of page 7, top of page 8.
House and close. Mileage reimbursement on 9. House and close.
10, Pay Plan, no
PS,
longer
house-
needed.
Yep. House and close.
Page 11,
Initiatives
Health
transfer.
Initiatives Transfer,
Got
no
the
core
house and close
changes.
there.
Page 12, Debt Offset
Everybody's the
Escrow.
same. 50 grand. House and close.
Page 13,
Refunds,
Refunds,
House
no
and
core
close.
changes. Page 14, Federal Grants and Donated, no core
Everybody's
changes.
the same. House and close.
Page 15, Donated Funds, no core changes.
House and close.
Page 16, Medical Preceptorship Transfer, Gov and House are the same.
House and close.
Page 17, DCPH Program Operations, no longer needed.
House and close.
Page 18, Cancer and Chronic Disease Control and Prevention.
All right, I've got a reallocation here on a Senate position, adding $73,270 in general revenue. Let's see, total down there at the bottom, I believe, is 9,300,000. Excuse me, 961 plus 19.79 FTE. Is that right?
Total 19.79 FTE.
Correct.
Yep. Bottom of page 18, Pay Plan.
Well, same here. We're going to have to take a Senate position, reallocate, adding 24,384 for a total of 72,214. If my math's right.
Yep.
Yep. Okay.
Top
Thank
of
you.
page 19, Alzheimer's Appropriation. Gov and
House.
House are the same.
Yep,
Bottom
House
of
and
page
close.
19
That's
is.
another one of those global things we can do, right? So
Yes.
we'll go with the governor here.
Okay.
on 19.
Page 20, environmental public health, no longer needed.
House and close.
Page 21, CDCP. Governor has the same.
Again, I think we've got another Senate reallocation here. Subtracting $68,055 in general revenue and $140,000 in Fed and 1.69 FTE, right?
Yep.
Okay.
Bottom of page 21, top of page 22, RN surveyor
Yep.
salary
Governor.
adjustment, gov. Page 23, community health and wellness.
Again, back to the Senate position, adding $100,000 general revenue and $774,908 in Fed, and 12 FTE.
13
Is that
FTE.
13 FTE?
Yep.
Okay, 1 GR and 12 paid for out of Fed funds,
Yep.
right? Okay. Thank you. 24.
Middle of page 24, fentanyl test strips.
Yep, go with the House.
Bottom of page
Close.
24, top of page 25, RN surveyor.
Back with the governor on that one.
Bottom of page 25, cannabis education.
Go with the House, $2.5 million on that. And then I've got an NDI here for the fentanyl testing of water in schools. It's kind of a pilot program, $7.5 million out of opioid funds.
Yep.
And close that one. 26. We were on 25, now we're on 26.
Page 26, tobacco
House
addiction
added
prevention.
$300,000 here. Go with the House. And close.
Page 27, tobacco cessation.
Go with the House on that. And I've got an NDI for tobacco cessation increase, 50,000 GR and 50,000 Fed, so a total of $100,000 on that increase. And close. 28.
Page 28, DCPH admin.
Again, we've got a reallocation here, so it'd be a Senate position, subtracting $400,000 in Fed funds, ending with $4,986,025. And close that one. Top of 29, same deal, reallocation, Senate position, so we're going to subtract $26,980 in GR, making that total $485,651. And close. Page 30.
Page 30, naloxone distribution, no longer needed.
House and close.
Page 31, emergency prep and response.
Go with the House on that one.
Bottom of page 31, pay plan.
And then I'm right here. We've got a little coding fix essentially on this one. So Senate position adding $57,963. So $65,019 total on that line. And close 32.
Page 32, ventilator and popper cash sustainment.
Yep. Go with the governor on that one. And then I've got an excuse me. I've got an NDI for the statewide EMS communication system, totaling $1,750,000, and let's do that out of budget stabilization. And close.
Page
33.
33, no longer needed.
House and close.
Page 34, environmental public health.
Another
House
one of
and government
these
same.
reallocations for the Senate, so we're adding $180,018 general revenue and a quarter of an FTE, so 0.25 of an FTE. And close that, 35.
Bottom of page 34, top of page 35, pay plan.
Same deal again, Senate position reallocation and adding, get this, $613.
Yep.
Fantastic. And close.
Middle of page
Middle of the page.
35, Legionella program. House
Yep,
and
go
government
with the House.
same. Bottom of page 35, top
Same
of page
deal
36.
here, go with the House.
Middle of page 36.
Lead
HEB.
hazard, House,
Bottom
close.
of page 36,
Back with the
top of page
governor on that.
37.
Yep.
Page 38, genetic and newborn health services.
Right, so we got, again, Senate position here. Let's take out $290,477 Fed and 3.5 FTE, totaling $4,429,958 and 15.7 FTE. And close out.
Middle of
39.
page 39, RN surveyor.
Governor. And close out.
Page 40, women's health initiatives.
House and close.
Page 41, no longer needed.
House and close.
Page 42, health informatics and epidemiology. House and Gov the same.
House and close.
Page 44, breast cancer navigation services. No longer needed.
House and close.
Page 45, Springfield doula services. No longer needed.
House and close.
Page 36, Core Faith Walker doula
House
training.
and
No longer
close.
needed. Page
I am not a speaker.
You're so much
Senator,
better.
Senator Washington, would you like
I'm
to be
so
recognized by the chairman of the Appropriations Committee?
I was gonna correct myself because
Sure, what do you got?
I like your cows. I just wanted to say, so with the Core Faith doula training, Was there any conversation with you to try to keep that active? I thought it was in, or I would have advocated for it, but if you don't feel it's necessary, I understand.
The House did add some doula training in a different section.
Okay, thank you. I'm so sorry, Mr. Chairman.
Apology accepted, Senator. Moving on. 47.
47, no longer needed.
House and close.
Page 48,
Another one of these Senate
HIV.
position reallocation, subtracting 194,431 in federal and 5 FTE, so totaling that line 108,854,761 and 42.5 FTE. Right?
yep.
And close.
Top of page
49.
49, disease intervention specialists.
House and close.
Middle of page 49, HCV
See,
testing.
house and close.
Bottom of page 49, top of page 50.
House, close.
Page 51, women's health services, no
House and
longer
close.
needed. Page 52, local public health agency.
support.
Gotta look at the house.
Yep, house and close.
Page 53, Elks Mobile
Dental.
Dental.
House and close.
Page 54, child and adult care food program,
House
no longer
and
needed.
close.
Page 55, no longer needed.
House and close.
Page 56, nutrition
Again, that's a
initiatives.
Senate position reallocation, adding 742,862 and 8.92 FTE.
Yep.
And close that one.
Bottom of page 56, increased nutritional specialist.
Yep, go with the house on that. So we're on 58.
Page 58, KC Hunger nonprofit, no longer
House
needed.
and close.
Page 59, no longer needed.
House and close.
Page 60, no longer needed.
House and close.
Page 61, rural health and primary care, House and Gov are the
Yep,
same.
house and close.
Top of page 62, HPLRP FTE, House and Gov are the
Yep,
same.
house and close.
Middle of page 62, HPLRP program.
House, close.
Bottom of page 62, top of page 63, graduate
Yep.
medical education.
$3.5 million. House and close.
Bottom of page
Behavioral
63,
health. House and close.
page 64, medical
Yes.
loan repayment, no longer needed.
Right. House and close.
Page 65, no longer needed.
House and close.
Page 66, no longer needed.
Thank you, Taylor. House and close.
Page 67, oral health services and initiatives, House and Gov
Yeah,
are the same.
I've got a Senate reallocation on this one too, right? Okay, subtracting $188,510 and 0.56 FTE on the federal side.
Yep.
Okay,
Page
Close.
68, Elks Mobile increase, 200,000.
yep. Let's do a Senate position and add 200, so make it $400,000 total. And then we've got an NDI underneath that, 10760. Let's see, with the dental increase of $90,000 GR,
Yep.
right?
Yep.
Okay. And close on that, 69.
Page 69,
Same
minority health.
reallocation here. We got a Senate position, subtracting 19,148 and a quarter of an FTE. And then subsequently, the pay plan in the middle there, we got a Senate position. There's your $613 that we mentioned earlier in general revenue. And close both of those. Page 70.
70, no longer needed.
House and close.
Page 71, no longer needed.
House and close.
Page 72, women's health and wellness.
Yep, again, we got a Senate reallocation here, subtracting $73,270 general revenue, $554,352 Fed, and 9.45 FTE.
Yep.
And close on that one. Then you've got the corresponding pay plan underneath, so a Senate position, subtracting 24,304 GR, so making that total 31,982.
Yep.
And close.
Top of page 73, erase maternal mortality.
Yep, house and close on that
Middle
one.
of page
Middle
73.
infant mortality review, house and close.
Bottom of page 73,
health and
safety grants.
Yep, house and close.
Middle of page 74, RN surveyor.
Go back with the governor on that one.
Bottom of page 74, top of page 75, comprehensive care.
Same as go house and close.
Bottom of page 75, doula registry.
House and close.
Page 76, fetal infant mortality review.
House and close.
Page 77, vital records
Another one of these
registration.
Senate reallocations, so we're subtracting 192,815 and 1 FTE.
Yep.
And close on that one. 78. Top
Page
of that.
78, vital records expanded operations.
House
Gov equals the
closed.
House. Page 70 through 92 have been either reallocated or reduced. Do you want to take a global decision?
Yeah, we might as well. Then we can just skip ahead because those are all going to be house
Yes, yep.
positions on that. Yep.
Yep.
So that gets
Go
us
to-
to page 93.
Yep.
Everybody.
COVID and ARPA. The House reduced $49 million.
Yep, we're going to go back with the governor on that one. And close out.
Bottom of page 93, top of page 94, ARPA grant expansion.
Yeah, same deal. Go with the governor on that.
Page 95, outbreak response, no
House.
longer needed. Page 96, state public health lab.
House and close. Then we've got a Senate reallocation underneath there, adding 37,643 GR, totaling 239,642. And close on that. 97.
Yep, bottom of 96 and top
Pepsi
of
stuff. Yep. House and close.
98, DSDS program operations.
House and close. And then again, we got a pay plan reallocation Senate position, subtracting $68,626 in general revenue, right?
Yep.
Okay. And close. 99.
Building HCBS capacity.
House and close.
Middle of page 99, RN surveyor.
Go with the governor on that one.
Page 100, no longer needed. Page 101, APS
So
and
house
NME
on
programs.
that. 101, house on that.
Top of page 102, adult protective services.
102, Adult Protective Services. Director. Yep. House and close.
Page 103, no longer needed.
Sorry. House and close.
Page 104, no longer needed.
House and close.
Page 105, no longer needed.
House and close.
And page 106, no
Could've
longer
done
needed.
Global on that one. House and close.
Page 107,
Oh, that's
Consumer
back to
directed?
that reallocation. Well, no, let's
This
just
is-
do, partial restoration of that cut that the House made. So adding $35 million of federal back in on that top of page 107. So the total would be $695,485,748.
Yep.
And close.
middle of page 107, FMAP.
Yep. House. And then I've got a new NDI, CDS, HCBS rate increase at $8,128,020 GR and $15,431,458 Fed, totaling $23,559,478. Thank you, Taylor, and close on that one.
Page 108, HCBS Medicaid.
Yeah, again, we've got a kind of a partial restoration here, Senate position, adding $27 million back in federal, so that total would be $629,569,511.
Middle of
And
page 108, FMAP.
Yep, house and close.
Bottom of page 108, top of page
Rate
109.
increase, house and close.
Page 110, HCBS enhancements.
Yep, house and close.
Page 111, senior growth fund transfer.
Go back with the governor on that.
Middle of page 111.
Same there, governor.
Transfer. Page 112, AAA contracts.
House and close.
Bottom of page 112, top of page 113, Older Americans Act Federal Authority.
House and close.
Bottom of page 113, Senior Services Growth and Development Fund.
House and close.
Top of page 114, Ombudsman Program increase.
House and close.
Bottom of page 114,
AAA increase, 10 million. House and close.
Page 115, AAA Give 5, no longer needed.
House
Page
and
116, AAA meal production, no longer needed. Bottom of page 116, increase to the AAA meal production. Gov and House are the same.
Yep, house and close.
Page 117, Meals on Wheels, no longer needed.
House and close.
Page 118, Alzheimer's grants, no core changes.
House and close.
Bottom of page 118, Alzheimer's hospice and education increase.
House and close.
Page 119, SILP, no core changes.
Yep, house and close.
Page 120, naturalization assistance, no core changes.
House, close.
Page 121, DRL program operations, House and Government the same.
Four, house and close.
Page 122, supplemental health care services, House and Government the
Same,
same.
house and close.
Bottom of page 122, top of page
Survey
123.
salary adjustment, go back with the governor on that one.
Middle of page 123, BNDD database
Database replacement, go with the house there, and then I've got two NDIs underneath there, EMS for high need schools, grant program, $3.6 million. Let's do budget stabilization on that one. And EMS instruction grant program, $317,000, also the same fund, do budget stabilization. And close on this, 124.
Is time critical
Time critical diagnosis, house and close, all the same.
Top
Salary
of
adjustment
page
salary again, go
125.
back to the governor on that one,
Page
126.
126, naloxone
Naloxone
distribution,
supply,
no
house.
longer needed. Page
Nursing
127,
home, house.
no core changes. Page
Adult
128,
cannabis,
no core
house.
changes. Page
29.
129, no core changes.
House and close.
Bottom of page 129, substance use disorder grants.
Yep, house and close.
Page 130, medical marijuana,
House
House and
and
Government the
close.
same.
Pay plan, house.
Page
Youth substance use on
131,
131, house.
page 132,
Liaisons.
youth services.
Yeah, go with House on that. Yep.
Page 133, peer respite services.
Yes. House and close.
Page 134, alcohol abuse prevention.
House and close.
Page 135, substance use disorder grants to judiciary, 250,000.
House and close.
Page 136, drug abuse resistance.
House and close.
Page 137, Veterans Commission transfer, no core
Yep.
changes.
House and close.
Page
13
138, no
million.
core
Veterans
changes.
transfer. House and close.
Bottom of page 138, increase.
House and close. And legal expense fund on 139. House and close. Thank you, Taylor.
Thank you.
Nice job. All right. Why don't we break now? That'll give everybody a little bit of a break on the committee and on our staff downstairs, and we will come back to finish up the numbers part of this. Let's say 30 minutes upon adjournment from session today. And then we will probably take a little bit of a break after we finish the budget bills and before we come back in and do language, just so we can get all the last minute details of language fixes taken care of before we come back in. So, see everybody 30 minutes upon adjournment from session today. Thanks.
Changes.
Yep, house closed.
Page 3, mileage reimbursement, no longer needed.
Yep, house and closed.
Page 4, pay plan, no longer
House
needed.
closed.
Page 5, children's division, residential program unit, no core
House and
changes.
closed.
Page 6, federal grants and donations.
House and closed.
Page 7, child care IT consolidated transfer,
House
no
and
longer
closed.
needed. Page 8, OAIT Fed transfer,
House and closed.
and there's an NDI on the middle of that page for additional authority.
House and closed.
Page 9, human resource centers.
House
No-
and closed.
Page 10, stat, no core changes.
House and closed.
Page 11, Missouri Medicaid Audit Compliance Unit.
House closed. 13.
Systems Management.
Go with the house. Close.
And then there's a new decision item for an increase in GR authority.
Yeah, $24,000, 157. House closed.
Page 14, MAC Provider Enrollment Center, no core changes.
Yep, no changes on the core. Go with the house. Next one down, let's go with Senate position. Add 795,000 GR and 7,155,000 federal to the NDI. One time.
Yes.
Yep. All right. Thanks, Cassidy. 15.
Page 15, Recovery Audit
Compliance. House closed.
Contract. Division of Finance and Administrative Services.
Why don't you run through the changes on this one real quick?
I go through the changes?
All right. Me too.
Sure.
Okay. Okay, in the office, let's see. Finance Administration Services, let's reverse a portion of the house reallocation and relocate it back at 108,608 and 1 FTE, and then we've got a reallocation of $6,633 GR and $4,289 Fed of E&E to Section 11223. Am I right?
Okay, and then the pay plan will also have to change on that one as well?
Yeah, same. Yep, same deal. Reallocation there. 2,375 GR, 1,404 Fed.
Okay, and then at the bottom of page 16, top of page 17 is a NDI for contracted staff and compliance monitoring.
Yep, house and close.
Page 18, Child Welfare Eligibility Unit.
House and close.
Page 19, it's a new House Section Compliance Services Unit.
Yep, house and close. 20.
Page 20, Contract Out Services.
House and close.
And then there's an NDI for compliance physical monitoring.
A little over $1 million added by the house and close.
Page 21, Revenue Maximization.
House and close.
Page 22, Receipt and Disbursement Refunds.
House and close.
Page 23, County Detention Payments.
Yep, house and close on the core.
Okay, and a governor NDI for additional authority.
Right. $200,000 go with the governor on that one. The middle of page 23, 24.
Page 24, Division of Legal Services.
Yeah, let's take a Senate position, reallocate. Let's see, 250,000 total, but it'd be 165,000 GR and 85,000 DSS Fed Fund and 2 FTE. Right?
Yes.
Perfect. Thank you.
Alright.
Close that one. Bottom of the page is pay plan.
Okay. Page,
Middle of-
middle of page 25, a NDI for implementation of diligent search requirements.
Go with the House.
Okay, and bottom of
Close.
page 25, top of page 26, FTE for the license suspension hearings.
House and close.
Okay, middle of page 26, a department NDI for additional FTE for the special assignment unit.
House and close. We got a fraud finder on the
Bottom of page
26.
26, top of page 27.
House and close. Welfare investigation.
Middle of page 27.
Yep. House and close.
Page 28, DLS permanency.
Yeah, same deal here. We're going to take a Senate position, all in 250,000, but 165 GR and 85 Fed Fund, 2 FTE.
Yep.
And close that one. 29. Pay plan 30.
Page 30, Title 4E reimbursement.
House
No
and
core
close.
changes. Page 31, non-reoccurring legal expenses. No core changes.
House close.
Page 32, parents' legal expenses. No core changes.
House and close. That's
All
book
right,
one.
that concludes Book 1. Book 2, Division of Family Support. Page 33, FSD admin.
I know it wasn't yours. We got a Senate position here, transferring out $25,000 E&E of CCDF funds to the Office of Childhood in DESE, and then we're going to reverse a portion of the House's reallocation and put back in 1,606,481 PS and 27 FTE under Fedline, right? And then we've also got reallocation out of $360,431 and 6 FTE to Section 11-223, and then we're going to reallocate out also 520 GR and 272,530 federal E&E in the same Section 11-223.
Okay, and then there will also be a change to the pay plan.
Correct. We've got, well, that, I think as long as all this math is exactly right, we're talking a reallocation of 20,839 GR and 26,524 Fed PS, same Section 11-223.
Yes, and then at the top of page 34 is the summer EBT cost to continue.
Yep. House and close.
Page 35, IM field staff and operations. And then more reallocations in and out. Page 35.
I'm on 35. All right, we got a Senate position here, reversing the House reallocation of $500,000 for public acute care hospital, restore half of the House's reduction of the vacant FTE by 433,808 GR and 499,534 Fed and 12 FTE, and then transferring out 2,180,233 and 45 FTE of CCDF Fed funds to the Office of Childhood and DESE,
Yes.
and then also reallocating out 983,340 GR and 1,820,897 Fed and 47.5 FTE to Section 11-223.
Yes, and then there will also be a change to the pay plan.
Yep. Pay plan transferring out 69,767 Fed to the Office of Childhood and DESE, and restoration of $13,882 GR and 15,985 Fed funds for the vacant FTE restoration. Also a reallocation of $37,984 GR and 50,835 Fed to, again, that same Section 11-223.
Yes.
Nice job, Cassie.
All right, and then top of page 36, this is for the review forms of SNAP, TANF, and child.
House and close.
Okay. Page 37, IM field staff and operations PHE.
You at the top of 37?
Yes.
Yep. House and close.
Okay, and
Governor in the
then-
middle of the page.
Yes. Page 38, SNAP ARPA.
Yep. House on the core, and then I've got an NDI 106, support direct social workers for $450,000 general revenue.
Yes.
Got it. And close on that one. Thank
Okay.
you. 39.
Page 39,
Core,
IM call center
House.
for CHIP.
Yep. House and close. Got the paper
Bottom
in the
of
middle.
page 39, top of page 40 is the robotic process automation.
Yep. House and close.
Page 41, IM call center for the adult expansion group.
House and close. You got the pay plan.
Page 42, the IM call center for
Center,
SNAP.
House and close.
Okay, bottom of page 42, top of page 43 is the robotic process automation.
House and close.
Page 44, IM call center for TANF. No core
House and
changes.
close.
Page 45, IM call center for childcare.
Let's do a Senate position here. Transfer out 595,864 PS and 225,000 E&E Child Care and Development Block Grant Fed funds to the Office of Childhood and DESE.
Yes, and then there will
Also,
also be a
yeah,
change.
you've got the change to the pay plan, so let's transfer out 19,068 Fed to the Office of Childhood and DESE.
Yes.
Thanks, Cassidy.
Mhm.
46.
Page 46, IM call center IVR for Medicaid and CHIP.
Let's do a Senate position at $2 million, adding 410,000 GR, $590,000 Fed, make it one time.
Yes.
Thank you.
Okay.
And close.
Page 47, IM call center for the IVR for SNAP.
Same thing, we're going to do a Senate position here, adding $410,000 GR, $590,000 Fed, making it one time for a total of $2 million. Thank you.
Yes.
Close. 48.
Page 48, public and acute care
Governor.
hospital.
Thank you.
Page 49, family support staff training.
Let's do the Senate position here and transfer out $20,000 for Child Care Development Block Grant federal funds to the Office of Childhood under DESE.
Yes. Page 50, EBTs.
House and close.
Okay, middle of page 50 is the SB 4590 and 105 implementation.
Yep. House and close.
Okay, bottom of page 50, top of page 51 is the summer EBT.
We'll do the House on the core, and then I've got a new NDI, Section 11126, the Double Up Food Banks, Bucks, Double Up Food Bucks, 2 million GR. And close on that one.
Okay, page 52,
52.
summer EBT program admin.
House and close.
Page 53, summer EBT program.
E&E, House and close.
Page
Polk
54, Polk
House
County
and
Trust.
close.
Page 55, famous costs.
House and close.
In the middle of page 55 is an
E&E,
NDI for additional authority.
House and close.
Page
Famous
56,
PHE.
famous PHE.
House and close.
Okay, in the middle of page 56 is a reallocation.
Yep, Governor on that one, and close.
Page 57, Metis Chip Magi.
Let's take a Senate position and restore $3.5 million of the House's $7 million reduction. So we'll go back half.
Yes.
Yep. All right. Thanks. And close on that. 58.
Page 58, Metis Chip Magi F PHE.
Yep. House and close.
Okay, in the middle of page 58 is a NDI for additional
Go
for
back with the governor on that one. 59.
Okay, page 59, Metis Snap.
Well, we're going to do something similar here and take a Senate position, restore half the cut, give them back $2.5 million of the House's $5 million
Yes.
reduction. And
Okay.
close. Page 60.
Page 60, Metis TANF. No core
House
changes.
and close.
Page 61, Metis Child Care Subsidy.
Again, let's do a Senate position here and transfer out $200,000 of PSD from Child Care and Development Block Grant funds back to the Office of Childhood under DESE.
Yes.
And close.
Okay.
That was page 61. Now we're on 62.
Page 62, Metis Independent Verification
House
and Validation.
and close.
Page 63, Metis ECM.
House and close.
Okay, NDI in the middle of page 63 for additional authority.
House, close.
Page 64, Metis PMO.
Go with the House and close.
Okay, NDI for additional authority in the middle
Same
of
in the
page
middle.
64.
Go with the House on that one, close. Adult Medicaid on 65. Go back with the Governor on that one.
Page 66, Metis Transitional Benefits.
House and close.
Page 67, Eligibility Verification.
Let's take a Senate position here and transfer out $165,068 E&E of the Child Care and Development Block Grant federal funds to the Office of Childhood and DESE. And close. 68.
Okay. Page 68, Eligibility Verification PHE.
House and close.
NDI in the middle of that page for a reappropriation.
Go with the Governor on that one.
Page 69, Food Nutrition Program.
House and close.
Page 70, Healthcare Industry.
House
This is
and
no longer
close.
needed.
Save Our Sons
Page
program.
71, Save Our Sisters and Sons Program.
Yep. We're going to go with the House on the core and then NDI for another $500,000 TANF funds on that. And close.
Okay.
72.
Page 72, the Geek Foundation, no longer
House.
needed.
Close.
Page 73, Higher Aspirations.
Go with the house, but I've got a new NDI underneath there, adding $100,000 in TANF.
Page 74, New Reflections,
New reflections.
no,
House and
no
close.
longer needed. Page
75,
75, Total Man.
Total man. Go with the house, and then I've got an NDI of $150,000 TANF underneath that line. And close.
Page 76, Community Program for Youth in Columbia.
House and close. Fathers and families, house and close. Program dollars in the middle, page 77. Go with the house and close.
Page 78, Future in Action.
Go with the house on future in action. Yep, house, and then I've got an NDI 11158 Youth Enrichment Center in Vernon County, $750,000 GR. And close. 79.
Page 79,
Communities and
Communities and Schools.
House and close. Everybody's the same.
And then a
Program
NDI
dollars
in the middle of that
So-
for additional
yep,
authority.
Go with the house on 79.
Okay. Page 80, Rise
Drew
Drew Lewis
Lewis.
Foundation.
House and close.
Page 81, Dutchtown Opportunity Coalition for Youth, no longer needed.
House and close.
Page 82, Hope Missions.
82.
Yes.
82, house and close, and then I've got an NDI underneath there, $250,000 out of budget stabilization funds. And close.
Page 83, Morningstar Life Center.
House and close.
Chairman?
Senator?
Yes, I believe that we had discussed allocating $500,000 for GR for Morningstar.
Yep, that's the next thing I'm going to say.
Okay, well, thank you.
You bet. So we're going with the house on the core at the top, and then we've got an NDI $500,000 GR per Senator Washington underneath there. You're welcome.
Page 84, Riverview West Fluorescent.
I think some people call it fluorescent. But let's go with the house, and let's do an NDI of $250,000 TANF funds underneath that line on the bottom of 84 and close those lines. 85.
Okay. Page 85.
Better Family Life. Go with the house on the core, and then we've got an NDI, 1 million TANF funds.
Page 86, Homeless Camp
Yep,
Study.
Close that. House and close on 86. Thank you.
Page 87, I Am King Foundation.
Go with the house on the core, and then I've got a $50,000 addition TANF funds underneath there. And close.
Page 88, St. Paul's
House and
Mentorship Program.
close.
Annie Malone's
House and
program.
close. Temporary assistance on
Page 90, Cash Assistance.
Let's do house on the core, and then an NDI, section 11160, the Matty Rhodes Center, $500,000 GR one time, and then same section 11160, 100 Black Men in Metropolitan St. Louis, $660,000 GR. And close. 91.
Page 91, The
Village.
Village.
Let's go with the house. Close.
Okay. NDI for program funding in the middle
House
of
and
that page.
close. Healthy Marriage
Page
Fatherhood.
92, Healthy
House
Marriage Fatherhood.
and close. Powerhouse Columbia, house and close.
And then an
Program,
NDI for
yep.
program funding.
House and close, middle of 93, 94.
Page 94, Adult Supplementation.
House and close, and I've got an NDI underneath there, new section 11171, Life Unlimited Accessibility Housing Project, 5 million GR.
Page
And
95.
close. I'm getting ready to go to 95.
Page 95, Supplemental Nursing Care.
To what, 92 page? That was on 94. Yep.
Page 95, Supplemental Nursing Care.
Go with the house and close.
Page 96, Blind Pensions.
Go with the house and close.
And then an NDI in the middle of that page for a
Program,
rate increase.
house and close.
Page 97, Blind Administration.
Yep, house and close. You got the pay plan.
Page 98, Rehab Services for the Visually Impaired.
House and close.
Page 99, St. Louis Society for the Blind and Visually Impaired.
House and close on that, and then we've got an NDI, $654,273 GR, and then an NDI new section, 11192, $500,000. Senator Washington. Good.
Is that GR?
You bet.
Thank you.
And close that. Page 100.
Page 100,
That was on 99.
The blind people.
Yep. Okay, we took the house position on the core, and then we added $654,273 GR, and then we made a new section, 11192, $500,000 per Senator Washington's request, and closed on that. Page 100.
Page 100, business enterprise.
House and close.
And then an NDI for additional authority.
House, close.
Page 101, refugees and legal
House and
immigrants.
close.
Page 102, child support field staff and operations.
House and close.
In the middle of page 103 is the SB 35 implementation.
Yeah, I'll go with the House and close on that. And then we've got a new section, 11201, Parent Court in Clay County, $50,000 of general revenue. And close.
Page 104,
That's a great
child
idea.
support enforcement call center.
Go with the House and close. Then you got the pay plan, 105.
Page 105, child support enforcement reimbursement to counties.
House and close. Distribution pass-through, 906, House and close.
Page
Debt
107,
offset,
child
House
support.
and close.
Page 108, Office of Workforce and Community Initiatives.
Yeah, we're going to do a Senate position. I'm just going to say this. With reallocations mentioned in prior sections to the PS, it'll be $4,415,109. E&E will be $802,767, and FTE will be 73.5. And then we've also got underneath here an NDI for the pay plan with reallocations from prior sections. Pay plan is going to end up being 61,198 GR and $78,763 Fed PS.
Page 109, community partnerships.
Sorry, my vice chair is making me laugh here.
Page 109, community
Yeah,
partnerships.
109, sorry. Yeah, House and close.
Page 110, Missouri Mentoring Partnership.
House and close.
Page 111, Adolescence Program.
House and close on the core. Then we've got an NDI 11225, the Community of Hope, $210,080 GR, and then another new section NDI, the Family Connects pilot program, $1 million GR on that one, and that'll close 111.
Okay. Page 112, West Central Missouri Community Action Agency.
House and close on the core. Then we've got an NDI for $1,884,922 GR, and then another NDI, new section 11228 for the Jefferson Franklin Community Action Corporation, $30,000 GR. And
And
close.
close.
113.
Page 113, a new House decision for the National Society
House.
of Black
Yep,
Engineers.
$150,000 added by the House. Go with House position. 114.
Page
Community work
114,
support,
community
House
works.
and close.
Page
SNAP
115,
employment
Missouri
training, House
Skill
and
Up.
close.
Page 116, SNAP Adult High School.
House and close.
Page 117, Adult High School.
House and close.
Page 118,
Expansion,
Adult
House
High
and
School
close.
expansion. Page 119, Summer Jobs Program.
House and close. And then I've got an NDI of $650,000 TANF underneath that line.
And close.
And close.
Page 120, JAG.
Go back to the governor on that.
Okay, and a
And
new
close.
decision item.
Right. So then we essentially just switch those dollars. Yep.
Okay.
And go with the governor there.
And on the top of
121.
page 121.
Yeah, let's do Senate position. Make the $400,000 GR instead of TANF on that line. 122.
Page 122, Foster Care Jobs Program.
House and close.
Page 123, Employment Connection
House
Program.
and close.
Page 124, MOCAN
House and
Training
close.
Program. Page 125, Mission St. Louis.
House and close.
And then an
Program dollars in the
NDI.
middle. House and close. Porterhouse
Page
KC.
126.
House and close. Yes, Senator May.
No.
All right, where are we? 127. I-Poor Life. Go with the house and close.
Page 128, Southside Early Childhood Center.
House and close. Then let's do an NDI $250,000 TANF on that line. 128 and close. 129.
Page 129, Manasseh Ministry.
House and close.
Page 130, United Ways.
Let's go with the house on the core, and then I've got an NDI underneath that for $5 million in TANF.
And close.
And close.
Page 131, Megan Meyer Foundation.
House and close on the core, then I've got an NDI underneath there, $350,000 TANF. And close.
Page 132, the Journey Foundation.
Go with the house on the core, and then I've got a new NDI, new section 11232, Local Initiative Support Corporation of Greater Kansas City, $200,000 GR. And close.
Page 133, Youth Build Works Programs.
Go with the house on the core, and then the program in the middle. Let's take a Senate position of $700,000, not 500, 700. And close on that. Then I've got two NDIs underneath that. Year-round youth jobs in St. Louis, $2.5 million of TANF. And the Youth Build KC, $250,000 TANF, also be the same section there. Right, Cassidy?
Yes.
Perfect. And close on that, 134.
Okay, page 134, the Corey Johnson Foundation.
Yep. House and close.
Page 135, the Temporary Assistance.
Core, go with the house.
And then an NDI for the out-of-school enrichment.
Yep, go with the house.
Top of page 136 is the ABC Today.
Go with the house on the core. Then I've got an NDI of $1 million TANF for Boys and Girls Club Center, right?
What page are we on? I'm
Yes.
sorry.
Page 136.
136. You can just say thanks. And moving on. 137.
But you said $1 million. I thought it was $2 million.
No, it's $1 million.
There's already
okay.
$1 million in the core for that program.
Just for Kansas City?
Yes, for the Boys and Girls Club.
Okay. For Kansas City only?
I believe so, yes.
Okay, thank you.
Senator May. Well, we're getting ready to start 137 right now. Go, Cassidy.
Page 137, Living with Purpose.
House and close.
Page 138, Serving Our Streets.
I'm going to save our streets. Go with the house on the core. Then I've got an NDI underneath there at $1.5 million for budget stabilization funds.
Page
And
139, Boys and Girls Club of the Heartland.
Go with the house on the core, and then I've got a $2 million GR NDI underneath there.
It ain't in the
And
pages and shit.
Page 140, Canby's Markets.
Go with the house on the core, and then an NDI underneath there of $100,000 TANF.
And close.
And close.
Page 141, Chris Harris Foundation.
Go with the house on the core, and then I've got an NDI underneath there again, $100,000 TANF. And close. 142.
Page 142, Four Walls and Beyond.
Go with the house. And close.
Page 143, Alphabet Academy Facility in Kansas City.
Go with the house on the core, and then I've got an NDI, actually two NDIs in 11235. The Lyrics Institute, $100,000 GR, and Arts Tech, $3 million GR also. And close on that. 144.
Page 144, Rose of
I'm
Sharon
sorry.
Ministries.
Mr. Chair, I'm sorry. Did you say Arts Tech?
Yes. Arts
Yes,
Tech.
I said Arts Tech.
Is that the one in Kansas City or is that somewhere else?
It's in
That's
Kansas
one
City.
in Kansas City.
Okay, thank you.
You bet.
Page 144, Rose of Sharon Ministries. It was a house NDI of 70,000.
Let's make it. Let's go. Let's add $20,000 to it. Let's make it a $90,000. So it's, I guess, it'd be a Senate position at 90.
Okay. Yep.
Thank you. And close that one.
Page 145,
145.
out of school enrichment.
Take again Senate position. Move the $2 million to TANF to GR funding.
Yep.
And close on that one. 146.
Page 146, Community Service League Drop-In Center.
Okay, let's take a Senate position and make the NDI for $1 million TANF. So we'd end up adding, I guess, $500,000 TANF funds, right?
Yes.
Okay. Yep. Thank you.
Page 147, Good Dads.
Go with the house on the core.
And then a new decision item.
Yep, new decision item in the middle of the page should be make Let's do $1.5 million TANF, so we'd end up adding 500,000, right?
Yes.
Okay. Perfect. And
Page-
close on that.
Page 148, alternatives to abortion.
House and close.
Page 149, St. Paul Mentorship Program.
Go with the house and close.
Page 150, pregnancy resource grants.
Go with the house and close, and I've got an NDI underneath there, 11243 for Generate Health, $1 million GR.
Yes.
And close.
Page 151, saving our children.
Take a Senate position, add $250,000 TANF and $250,000 of opioid funds, so it would be total NDI of $1 million, right?
Yes.
Perfect. Thank you. And close 152, community service block grant. Go with the house.
Page 153,
53.
Impact 100 in Crawford County.
House and close.
Page 154, Community Assistance Council.
Let's go with the governor on the core, and then I've got an NDI, new section underneath there, 11248. Project 360 Youth Services for $1 million GR, and close on that. 155.
Page 155, the Community Assistance Council
Council,
building.
go with the governor, and close.
Page 156,
Food
Food Distribution
Programs,
Program.
House, and close. What's your question, Senator?
I'm sorry. I was asked to try to protect on page 154, the Community Assistance Council. I know, I was trying to call your name. I think you said governor's recommendation, and this is something that community, I think it's in hopefully outgoing Senator Razor's district, but it does cross over a little bit in my district as well. And we would definitely like the House recommendation of 500,000. It could be TANF, but it is for homelessness, feeding hungry children. They help with utilities and all sorts of things, so we really need it.
Appreciate that. Going with the governor. Thank you. 156. Did that. House and close. 157.
Page 157, Emergency Solutions Grant Program.
Go with the house and close. Then I've got an NDI underneath there, 11251. St. Louis Red Circle Food Bank, 1,904,000 TANF.
Yes.
And close.
Page 158, Energy Assistance.
House and close.
Page 159, Energy Assistance Cares.
House and close.
Page 160, Capable Kids and
House and
Families.
close.
Page
Fontaine Neighbors,
161.
House and close. Habitat for Humanity, St. Louis, go with house on the core. And I've got an
Page
NDI.
160.
I've got an NDI for $250,000 GR underneath there.
Yep.
162 and close. Good?
Okay. Yes.
right,
Page 163, Future
Outwards
Leaders.
Network, go with the Senate position, make the NDI $7 million, funded by TANF. Okay? And close.
Page 164, Domestic Violence.
House and close.
And then an NDI for Federal Authority.
Yep. House, close.
I'm sorry. Don't get mad at me. On 163, did we take the House position?
No, we increased it and replaced it with TANF dollars.
Okay, increased it to how much?
$7 million.
Yes.
On 163?
Yes.
For the Future Leaders Outwork, we gave them $7 million?
Yes.
Okay.
Nope.
Okay.
165.
165, Emergency Shelter Services.
House. Sorry, house and close.
Page 166, Women's Shelters with a History of Substance Abuse, Amethyst Place.
Go with the house, and then we've got an NDI underneath there of $100,000 TANF. And close
Close.
on that. 167.
Page 167, Giving Hope and Help.
House. And close, and we've got an NDI for another $50,000 in TANF. And close.
Page 168, Synergy Housing Project.
House and close.
Page 169, Diamond Diva Empowerment Foundation.
House. Close.
Page 170, Kathy J.
Go
Weenman
with the house
Shelter.
and close.
And then this is more authority for the Diamond Diva Empowerment Foundation.
400,000 added by the house and close.
Page 172, VOCA Admin.
House and
And
close.
Okay, page 173, VOCA Program.
Go with the house on the core
And then a new decision item in the
Senate
middle of that
position
page.
increase NDI by 7,532,000 GR. Total NDI would be $24,495,343. Right? And close.
Page 174, assist victims of sexual assault.
House and
Appropriations.
close.
Okay. And that concludes book 2. Book 3, Children's Division, page 175, Children's Division Admin.
House and close.
Page 177, Child Abuse and Neglect Hotline Unit.
House and close. You got the pay plan.
Page 178, Children's Field Staff and Operations.
Let's take a Senate position, reverse the House reallocation to the birth match program of 103,182 and 2 FTEPS, right?
Yes.
Okay, thank you. And close that.
In the middle of page 179 is
Senate
the
Bill
SB 186 implementation.
Yep, House and close.
On the bottom of page 179, top of page 180 is the caseworker visit cost to continue.
House, close.
Middle of page 180 is the CWIS support.
House and close.
Top of page 181 is the
181.
CD vehicle fleet management.
Yep, House and close.
Middle of page 181 is the foster parent
House,
support.
close.
Bottom of page
Children
181,
field
top
staff.
page 182.
House and close.
Page 183, Children's Division diligent search.
House and close.
And then an NDI in the middle of that page.
Right, House and close.
Page 184, Family Centered Services.
House and close.
Page 185, Team Decision Making.
House and close. Pay plan.
Page 186, the CCWIS system replacement.
Go with the House, close.
Page 187, Staff Training.
House and close.
And then an NDI in the middle of that page for Bachelor of Work, Social Work.
House and close on that.
Page 188, Staff Training,
House
Special
and
Investigation.
close.
Page 189, Trafficking and Exploitation.
House and close. Get the pay plan.
Page 190, Prevention of Human Trafficking.
House and close.
Page 191, Prevention of Human Trafficking Grants.
House and close.
Page 192, Brief Strategic Family Therapy.
House and close.
Page 193, Parent-Child Interaction Therapy.
House and close.
Page 194, Birth Match Program.
Yeah, let's do a Senate position here. Reverse the House reallocation of field staff and operations of 103,182 and 2 FTEPS. And close on
close.
that. 195.
Page 195, Children's Treatment
House
Services.
and close.
Page 196, Crisis Care.
House and close.
Page 197, Court Order Drug Testing.
House and close.
Page 198, the Family First PSA Community Setting Grants.
House, close.
And then an NDI in the middle of that page for a reallocation.
Yep, 5 million. House and close.
Or a reappropriation. Page 199, the Family
Setting
First PSA
contracts.
Community Setting
Yep,
Contracts.
house and close.
Okay, and then an NDI for a reappropriation in the middle of
House.
that page.
Yep, house close.
Page 200, the Family First PSA Provider
House.
Grants no longer
Close.
needed. Page 201, the Family
First
First
program.
PSA Development and Startup
Yep,
Prevention.
house and close.
And then an NDI for
Family
a
first PSA,
reappropriation.
house and close there. 202.
Page 202,
Family
the
First.
Family
House.
First. And then an NDI.
Close.
the
Same,
middle of
house
that
and
page.
close.
Page 203, Foster Care.
Let's go with the house on the core.
Okay, and then there is a FMAP is the same between the governor and the House throughout the budget, besides one in Book 5. So I don't know if you
Global
want.
position there.
Okay.
That's fine.
And
Just
then
take
I'll
the
hit
house.
I'll
Yep.
hit that one in
Yep, that's
Book
fine.
5. Okay. Page 204, Foster Care Outdoor Program.
House and close.
Page 205, Foster Care Maintenance Program.
House.
Payments.
You got the FMAP again.
Yep.
So that's house.
Page
Therapeutic
206, Therapeutic Foster Homes.
House. And close.
Page 207, Qualified Residential Treatment Program.
House. And close.
Page 208, the QRTP non-IMD.
House. And close on that. 209.
Page 209, the QRTP
Yep,
IMD.
house and close.
Page 210, Residential Treatment Services.
House and close.
Page
Foster parent
211,
training.
Foster Parent Training.
House and close.
Page 212, Foster Parent Support.
Go with the house on the core. Then I've got, we'll do a Senate position, make this new NDI reflect the foster parent support NDI in section 11.310 of $1,796,878 GR and $530,090 of DS Fed funds of PS, and $1,080,049 GR and $318,621 of same DSS Fed funds E&E, and then it would be 50 FTE.
Yes.
Okay.
And then,
And then you got corresponding pay plan
yes.
pickups essentially. So 57,501 GR and 16,963 in Fed funds.
Yep.
And close on that. 213.
Okay. Page 213, foster youth educational
House and
assistance.
close.
Page 214, foster care case management
House and
contracts.
close.
Page 215, management contracts.
House and close.
And then an NDI for a reappropriation.
Yep. Go with the house on that and close.
Page 216, adoption subsidy payments.
Go with the house. You got the
And then
FMAP in the
FMAP.
middle.
And then bottom of page 216, top of page 217 is the child welfare
Cost to continue.
yes.
House and close. 218.
Page 218, guardianship subsidy
House
payments.
and close, and you got the FMAP, in the
FMAP,
middle.
bottom of page 218, top of page 219 is the child welfare cost to continue.
Go with the house and close on that. Kinship
Page
Navigator
220,
Services.
kinship navigator program.
House. Close.
Page 221, live to give hope.
Let's go with the house on the core. And then I've got a new section 11409, the kinship care, $55,000 general revenue.
Yes.
And close.
Okay.
222. Family
Page
Resource Centers.
222, family resource centers.
Go with the house on the core, and then I've got a couple of NDIs. Central Missouri Foster Care and Adoption Association, $950,000 GR, and then the Foster Adopt Connect, $600,000 GR, and the Foster and Adoptive Care Coalition at $500.
Yes.
And close.
Page 223,
GR.
the kinship navigator program.
Go with the house and close on that one.
Page 224, behavioral interventionist program.
Go with the house on the core, and then an NDI, additional behavioral intervention services, and $950,000 DSS Fed funds.
Yes.
And close. 225.
Page 225, the FRC for Wright County.
Family Resource Center, Wright County. Go with the house, 300,000.
Close.
And close, yes.
Page 226,
Cape
adoption
Girardeau,
resource.
go with the house and close.
Page
Transitional
227.
living. Yep, house and close.
Page 228, independent living
Go with the
placement.
house on the core.
And then an NDI in the middle of that for the aftercare increase.
Going with the governor on that one, and then a new section underneath there, 11.4.16 for children's transition from foster care. Kind of a pilot program, $616,000 GR. And close.
Page
229.
229, child assessment centers.
House and close.
Page 230, KC Child Advocacy Center.
House and close.
Page 231, the CAC's prevention
Yep,
of
house
sexual
and
exploitation.
close.
Page 232, the 4E Authority Juvenile Courts.
House and close.
Page 233, the 4E Authority.
CASA, yep, house and close.
Page 234, child abuse and neglect.
grants, house and close.
Page 235, foster care children's accounts.
All right, we on the last page? 235?
Yes.
Do it.
Foster care, page 235, foster
Yep.
care children's accounts.
Go with house.
Okay. And that
close.
concludes book 3. Book 4, Division of Youth Services, page 236, DYS Admin,
Go with the house and close.
page 237, Youth Treatment Programs,
House, close.
followed by the pay plan and the
And then
FMAP,
FMAP, so house.
Page 239, Juvenile Court Diversion Program.
House and close.
And that concludes Book 4. Book 5, Division
Book 5.
of Missouri Health Net. Page 240, the MHD admin.
Yeah, we're going to go ahead and take a Senate position here and reverse both the House reallocations of MHD transformation. $516,740 and 6 FTE of PS and $1,185,092 of E&E, and then also restore the House reduction of $9 million of their E&E line. And close on that.
Okay. Top of page 241 is the PACE rate increase.
Yep. House and close.
Middle of page 241 is the diagnosis-related groups.
House and close.
Bottom of page 241, top of page 242
MMIS.
is the
Yep. House and close.
middle of page 242 is the compliance tool.
House and close.
Bottom of page 242, top of page 243 is the MMIS data management office.
Yep. House and close.
Page 244, pharmacy program management.
House and close.
Page 245, MHD transformation.
Let's go with the governor on that and close.
Page 246, data management office.
House and close.
Page 247, third-party liability contracts.
House, close.
Page 248, information systems.
Yeah, Senate position here. We're going to restore a portion of the $55 million E&E reduction and the $5 million GR and $30 million of DSS Fed funds in that line.
And then a NDI in the middle of page
Go with
248.
the House on the NDI there.
Bottom of page 248, top of page 249 is the MMIS
House.
enrollment broker.
And then the security
Middle-
risk assessment MIS. Go with the House on that, 249.
Bottom of page 249, top of page 250 is the
Pharmacy.
MMIS pharmacy solutions
Go with the
trend.
House. And
Close.
close.
Page 251, this is a new subsection, the BIS EDW.
Go with the House.
Okay,
And
then
close.
NDI in the middle of that page for operational
Yep.
costs.
House and close.
Page 252, the BSPC enrollment broker.
Go with the House.
And then an NDI
close.
in the middle of that page.
Go with the House.
Page 253, the CMSP.
Go with the House.
And then an NDI in the middle of that page.
E&E, House and close.
Page
Pharmacy Solutions,
254,
House and close.
and then an
E&E.
NDI.
Yep, House and close.
255, managed care
management tool,
contract.
Yep, House and close.
Page 256, closed loop social service referral platform.
Go with the House. Close.
Page 257, electronic health records.
House
This is
and
no longer
close.
needed. Page 258, high tech. This is no longer needed.
House and close.
Page
Health data
259, help
utility.
data utility.
House. Close.
Page 260, show me home. There were no core changes.
I'm on 260 and I'm on Money Follows the Person grant. Is that where you are? Unless
Yeah,
I'm-
it's the same item.
Same?
Yeah, same thing.
House and close.
Okay. Page 261,
Pharmacy.
pharmacy solutions.
House, you got an F map in the middle of the page. House. Top
And then
262.
bottom of page 261, top page 262 is the pharmacy specialty
Yeah, Go back to the
PMPM.
governor on that one.
Okay, and then in the middle of that is for the non-specialty NDI.
House and close on that one.
Bottom of page 262, top of page 263 is a new decision item for the MHD cost to continue.
Yep, House and close.
Page 264, pharmacy Medicare Part D.
House and close.
And then
HCS
NDI in the
cost to
middle of that.
continue. Go back to the governor on that one.
Page 265, the Missouri RX plan.
House
And then
Close.
NDI in the middle of that page for the
Yep,
MHD
governor.
cost to continue.
and close.
Page 266, pharmacy FRA payments.
We'll go with the house on that.
Okay. And then an NDI for the FRA provider tax restructure in the middle of that
go,
page.
go with the house.
Page 267, physician services.
Go with the house.
Okay, followed by the
FMAP,
FMAP. And then
so
bottom of
house.
267, top of page 268 is the MHD cost to continue.
Yep, house and close.
Middle of page 268 is the
lab
independent
increase,
lab
house
rate.
and close.
Bottom of page 268, top of page
Ophthalmologist rate,
269
yep.
is
House
the okay.
and close.
Middle of page
Autism rate.
269 is the
Go with
autism
governor.
services. Bottom
Close.
Bottom of page 269, top of page 270 is the prenatal
Prenatal care
care.
payments, house and close on that one.
Okay. Page 271, neonatal abstinence syndrome.
Yep, house and close.
Page 272, trauma treatment for children.
House
And close.
and close. CCBHO's top of page 273. House and close.
And then this
Yep.
was the FMAP change. The House reduced 12 million GR from the core, and then fund switched the 12 million
Yeah,
to the
that's
FAD
fine.
and
Go with the House.
GI.
Pace. on
Page 274, PACE. No
House.
core changes.
FMAP in
And
the
then
middle.
FMAP, bottom of page 274, top of page 275 is the PACE rate increase.
Yep. House and close.
Middle of page 275
Cost
is
to
the
continue,
MHD
House.
cost continue.
And
And close. Page 276, dental services,
House and close.
followed by the FMAP.
FMAP's
And then
House.
bottom of page 276, top of page 277 is the cost to continue.
Go with the house. And then
Middle of page
program house. Yep.
277.
House
the
and close.
dental- Yep. And close.
Premium. Yep. Premium payments on
278,
Go
no
with
core
the house.
changes.
Then you got the FMAP, so house.
Bottom of page 278, top
Premium
of page
increase.
279 is the premium increase.
House. Cost to continue. House.
And close.
Yes. Nursing facilities.
Page 280, nursing facility payments, no core changes.
Yep. Go with the house on that.
Followed by the
FMAP, so
FMAP.
house.
Bottom page 280, top page 281 is the cost to continue.
Yep. Let's go with the governor on that one.
Middle of page 281 is the NF rate rebase in hospice.
Yeah, let's go with the Senate position here. NDI increase GR by 10 million. Fed funds by 28,985,507. So new total of 145,652,174 for the NF rate rebase and hospice.
Yes.
All right,
And close.
and close.
Page 282, nursing facility value-based
Value-based
payments.
payment. House close.
Followed
FMAP
by
house.
FMAP. Bottom page 282, top page 283 is the NF rate rebase in hospice.
House and close.
Page 284, home health,
House and close.
followed by the FMAP.
Yep, so it's house. Well, I've got a new NDI under here. Home health rate increase of 123,096 GR and 233,705. Fed funds, new rate of 137.61 up from 125.19.
Yes.
And close.
Page
285.
285, nursing
facility
facilities
federal
FRA
reimbursement.
payments.
Yep, house and close.
And then a new decision item in the middle of that page
Hmm.
for the FRA provider tax restructure.
House, close. Nursing facility provider tax on, I'm on 286.
Yes,
There we are.
page 286, nursing facility provider tax.
House on that core.
And then a new decision item, the House reallocated in funds.
Yep, house there. And then I've got NDI new section 11738, assisted living facility rehabilitative and preventative care services of $1 million GR. Fed funds to allow for some flex. So I think that's section, 11175? Right?
Yes.
Okay. And close.
Page 287, long-term
care
support payments.
House, FMAP in the middle, house.
Page 288, rehab and specialty services.
Governor. And then we got
Close.
the FMAP. Yeah, and close. FMAP in the middle, so
And then
house.
bottom of page 288, top of page 289 is the hospice rate increase.
Yep. So we got, again, Senate position here, increase with the NDI by 1.076 million GR and 2,042,841 Fed funds. So total NDI amount of $3,507,820.
Yes.
And close.
And then in the middle of that page, there is an NDI for the cost to continue.
Right. Go with the house on the cost to continue, 15 million.
Bottom of page 289, top of page 290 is the provider tax restructure.
Yeah, I go with the house on that. And close.
Middle of page 290 is an NDI for the NF rate rebase in hospice.
House, close.
Bottom of page 290, top of page 291 is the ground ambulance rate increase.
House and close.
Middle of page 291 is an
Air
NDI
ambulance
for the
rate
air
increase.
ambulance
House and
rate.
close.
Page 292, non-emergency medical transportation.
Go with the house. We get
Followed by the
FMAP in the
FMAP.
middle.
Bottom of page
House.
292 and top of page 293 is the NEMT actuarial.
House and close.
Middle of page 293 is the cost to continue.
House, close.
Page 294 is the ground emergency medical transportation.
House,
No core changes. Followed by the FMAP.
close. FMAP,
And then
so house.
page 295, complex rehab technology products. There were no core changes.
House and close. FMAP in the middle.
Bottom of page 295, top
continue.
page
Yep,
296.
Close.
Page 297, managed care.
Let's do a Senate position here and reallocate within section for managed care, Medicare parity payments. 14,983 Fed funds to GR to adjust for the FY25 blended FMAP rate.
Yes.
Right? Okay.
And
And
then
then let's restore the House reduction of 53,869,841 PS.
Yes.
And close. Then you got the
Follow
FMAP.
my FMAP, and then bottom of page 297, top of page 298 is the MC actuarial.
Yep, gov. Close.
Middle of page 298 is the ground ambulance rate increase.
House and close.
Bottom of page 298, top of page 299 is the air ambulance rate increase.
House and close. Then I've got an NDI here. Managed care, Medicare parity payments, 500,000 GR and 949,276 Fed funds.
Yes.
Got it. And close.
Page 300, managed care general plan public GEMT.
House and close.
Page 301, managed care specialty plan.
House and close. You got the FMAP underneath that. House
Bottom
and close.
page
Actuarial
301,
increase, governor. And close. Cost to continue. Go with the governor. 303.
Page
Specialty plan
303, managed care specialty plan public
Yep, House and
GEMT.
close.
Page 304,
Hospice care,
hospital
house and
services.
close. You got the FMAP underneath that, so that's a
And then
house.
the OPFS trend.
Yep, house and close there.
And then in the middle of
Program.
page 305 is the cost to continue.
Yep. House and close.
Page 306, hospital and clinic projects.
Go with the house on the core, and then I've got a couple of new NDIs. 11171 for the Boot Heel Healthcare Foundation in Dunklin County. $10 million of budget stabilization. We've got same section. They're all going to be in the same section. 11171 Kirksville Hospital, the Hannibal Regional Healthcare System at $15 million GR. Children's Mercy in Kansas City, $25 million GR. Cameron Regional Hospital, $1,761,000 GR. The Golden Valley Memorial Hospital at $425,000 GR, and Mercy in Mountain View at 1.5 GR.
And close.
And close.
Page 307, torch.
House.
There were no core changes.
Yep. House and close.
Page
Dr.
308,
Branson.
Branson Super Clinic.
Yep. Did that last year. House and close.
Page 309,
Phelps.
Phelps Health Emergency Room.
Yeah, let's do the Senate position. Increase the NDI by 2 million GR. Total NDI amount would be 5 million GR.
And close.
And close.
Page 310, Pediatric Pilot Program.
House and close.
Page 311, Health Clinics.
House and close.
Page 312,
All
Physician
the
Payments.
Same. House and close. FQHC.
Page 313.
House.
Page 314, Women and Minority Healthcare
All the
Outreach.
same. House and close.
Page 315, Substance Abuse Prevention Network in Jordan Valley and Springfield.
House and close.
And then an NDI in the middle of that page
E&E.
for additional authority.
House. Close.
Page 316,
We're on page 316 now.
Subs-
Substance Abuse Prevention Network. Go with the house on that.
and then an NDI for additional authority in
Again,
the middle of that
E&E.
page.
House and close. Technical assistance
Page
contracts.
317.
Everybody's the same, right? House and close.
yes.
No changes. Yes, we did.
Page 318, Health Homes.
Health homes. House and close. Got the FMAP.
And then bottom of
Middle,
page 318, top of page 319.
Cost to continue. House.
Page 320, a new section for the children with medically complex conditions.
House. Close.
Page 321,
321.
FRA.
House. And close on
And then
that.
a new decision item in the middle of that page.
Yep. House and close.
Bottom of page 321, top of page 322 is the FRA provider tax
That's a little
restructure.
over $1 billion on that line. Yeah, House and close.
Page 323, the IGT Safety Net Hospitals.
House on the core, and then I've got an NDI, indirect medical education for public academic medical centers at $12,675,000 Fed funds and $6,825,000 DSS IGT funds.
Yes.
And close.
Close. Page 324, CHIP.
House and close. You got the F map in the middle, so that's
Bottom of
House.
page 324, top of page
Actuarial.
325 is the actuarial.
Governor on that one.
Middle of page 325 is the pharmacy
Pharmacy.
specialty.
Yep, House, close.
Bottom of page 325, top of
Children's
page
insurance.
326.
House, close. Cost to continue in the middle of the page. House, 327.
Page
CHIP
327, CHIP Public GEMT Services.
House, close.
Page
Babies.
328, Show Me Healthy Babies program.
House and close.
And
F
then
map in the
FMAP.
middle.
Bottom
House.
of page 328, top of page 329 is the actuarial.
Yep. Governor on that one.
Middle of page 329 is the
Pharmacy
pharmacy
specific.
specialty. Bottom of page 329, top of page 330 is the pharmacy non-specialty.
House, you get the cost to continue in the middle of 330, so go with the House on that.
Page 331, school district medical claiming.
House, close. Cost to
And then
continue.
NDI.
Governor.
Page 332, blind pension medical benefits.
House and close.
And then an NDI in the middle of that page for the
Yep.
pharmacy specialty.
House.
Bottom of page
Close.
332, top page 333 is the pharmacy non-specialty.
House and close.
Middle of page 333 is
Cost
the
to
cost to
continue.
continue.
Go with the House.
Page 334, adult expansion group.
Go with the House.
NDI in the middle of that page for the MC
Let's go back with the
actuarial.
Governor on that one.
Bottom of page 334, top page 335 is the pharmacy specialty.
House. Close. Pharmacy non-specialty.
Middle of page 335 is the pharmacy
House
non-specialty.
and close.
Bottom of page 335, top page 336 is the Missouri maps.
Yep.
The House reallocated this to a different
Yep,
section.
that's fine. House, close.
Middle of page 336 is the
Cost to
IGT.
continue. Yep. House and
DMH.
close.
Okay. Bottom of page 336, top page 337 is the cost to continue.
House, close.
Middle
Air
of page
ambulance rate increase.
337 is
House.
the air ambulance.
And
And
close.
Page 338, the adult expansion group Missouri maps.
Mm-hmm. Let's do a Senate position. NDI add 64,548,792 Fed funds and 7,172,087 of DSS IGT funds. So total amount would be $88,084,966. And
Yes.
close. 339.
Page 339, adult expansion group DMH IGT.
Yeah, we're taking Senate position again here and restore the 43,462,500 that the House cut out.
And close.
And close.
Page 340, the AEG public GE
House. and
services.
Close.
Page 341, the IGT expenditure transfer.
Core. House and close. Okay.
2. IGT DMH Medicaid program.
Go with the House on the core.
And then an NDI in the
Governor
middle of
on
that
the
page.
cost to continue.
Page 343, the pharmacy provider tax transfers. And this pages 343 through 335 are transfers with no core changes besides 2 NDIs.
Yeah, so we'll take the House on this core, and then really you can just take the House position on all of those, right?
Mm-hmm. And then I'll just hit the NDIs.
Yeah, 343 to 355.
So on
Okay.
page 347 is a NDI for the FRA transfer appropriate on the federal reimbursement allowance transfer.
I'm familiar with it. Okay. House.
And then the other new decision item is on page 355, the FMAP enhancement fund transfers.
Sorry, where are you?
Page 355, there's an NDI on that page for the enhanced FMAP transfer to the budget stabilization.
House. And close on
Close.
that. Yep.
Page 356, the enhanced FMAP to Title 19 transfer.
Go with the Governor on that one.
Page 357, the enhanced FMAP expansion funds to the Title
And
19
go back to
transfer.
the Governor on that one. And
And
then the
then
legal
the
expense
legal.
fund. House.
Yep.
Good job,
All right,
guys.
and that concludes social services.
Yes.
All right, let's go ahead and get started on House Bill 12, elected officials. Adam, whenever
First
you
up, page
are ready.
1 of 7 is the governor's office, no core changes.
Yep, House and close.
Page 2 is mansion operating
House,
expenses.
close.
3, not needed. 4,
House.
not needed.
House.
5 is the National Guard line, no
House and
changes.
close.
6
Audits.
is special
House.
audits. 7 is the new item added by the governor.
Yep. Gov. On that.
Then we go to the lieutenant governor's office. Page 1 of 11 is the operating core for that, no core changes.
House.
Page 2
close.
is the mileage, not
House
needed.
and close.
3, not needed.
Not needed.
4, we move into the Arts Council. No
Yep.
changes to the core.
House on the core, then NDI, the Arts Council Trust Fund spending authority increase of $880,929. And close. And then we've got an NDI underneath there with the same section, $3 million, St. Louis Symphony.
Yes.
And close.
Page 5 is public television grants, no changes.
So go with the House on the core, then I've got an NDI underneath there, increasing about $500,000. And close. 6.
Page 6 is the Missouri Humanities Council. Governor and the House are the same on the core.
So go with the House on the core, and then NDI increased spending authority by $3 million.
Yes. Middle of the page is the Ebenezer Historical Society. That's a House added back
Oh
in.
yeah, leave that in. That's fine. House on that, and then I've got a handful of NDIs here to run through real quick. We've got the Negro League Baseball Museum increased by $500,000. You guys probably remember that's been in the budget for about $500,000 for several years. So it'll be $1 million total. The Buck O'Neill Center increased by $250,000 to $350,000. So new total $350,000. Kansas City Museum at $5 million. Springfield Area Sports Commission under the Arts and Humanities Council $250,000. Repertory Theaters $1.5 million. Lyric Opera $2.5 million. Springfield Art Museum at $10 million. The Little Theater, same town, $5 million. Arrow Rock Theater at $160,000. The Bellefontaine Cemetery Historic Building Restoration $4,050,000. And the Juneteenth, it was actually moved, if you guys remember, I'm sure everybody remembers, from House Bill 7 in DED. It's now over here, and that's $1 million. We've also got the African American Museum in St. Louis at $3 million. Adam, is that right?
That is correct.
Okay. Did I miss anything?
Nope.
I shouldn't have said that. Tell me one thing, Senator May.
I think it's the same as the 3.
It's not. I don't think it's 1.2. I think we made it 3 million. Yes. At 1.5 million. All right, sounds good. And we'll close on that page. Page 7.
Page 7, this was the KC Arts Asylum that was
Yep.
added by the House.
House, close.
Page 8 is the Arts Council GR transfer, no core changes.
House on the core, then an NDI increase GR transfer by 3 million.
Got it.
House and close.
Page 9
Next
is
page.
the Humanities Council
I jumped
transfer,
ahead.
no
Yes.
changes to the core.
That was the house and close I just said. And then we got an NDI increase, transfer by 30.26 million, GR 15.26 million, budget stabilization at 15. And close on that. Humanities GR transfer, bottom of
That-
page 9.
Yep, that was for Ebenezer.
Yep, house.
And then on page 10 was for the KC Arts.
Yep,
Item.
house. And close. 11.
Page 11 is the Public Television GR transfer.
Make an NDI and increase that by 500. Okay, $500,000. And close on that.
Then we moved to Secretary of State. There were no changes on page 1 of 20 to the core.
Okay, house and close on the core.
New DI was the same.
House, close. Got the pay plan.
Yep, middle of page 2 is another new decision item that Governor and House were the same.
House, close.
Page 3 is not needed.
So go with the house.
Page 4 is grants and projects for the Secretary of State, no changes.
House, close.
Page 5 is the refund
Refunds,
section.
House and close.
Page 6, investor
Investor
restitution, no
house and
changes.
close.
Family trust
Family
fund on
fund,
page
house and
7.
close.
Election public notice, $1 for the core, and then the
Yep.
new increase
House.
for the election coming up.
Yep, the 3 million, go with the house there.
Page 9 is the absentee ballot, same thing, House on the core,
House.
and the new DI for the election that is coming up.
Correct, house and close.
Page 10 is federal election reform, no changes.
House and close.
Page 11 is the election cost GR
House and
transfer.
close.
There's a new DI again associated with the
Again,
election.
same numbers, house and close, 9.5 million. Federal
Page
grants.
12 is federal grants.
House,
Page
close.
13 is local records grant.
Grants, house and close.
14 is document preservation.
House, close.
15 is state aid to public libraries, no changes.
Let's go with the house and close and a new NDI of $3 million for the KC Public Library, budget stabilization, so on the bottom of page 15, that's where that is. And close. 16.
16 is the REAL program, no changes.
Real.
Remote
program.
access for libraries.
And close.
17 is federal aid to libraries.
Yep. House and close.
18 is the library networking fund spending authority, no changes.
House and close.
19 is the GR transfer to that
for the same
fund, no
number, House and
changes.
close.
And 20 is the
Blue
section
books,
for the blue books.
$50,000 of blue books. House
Page
and close.
1 of 4 is the Office of the State Auditor. There are no core changes.
Go with the house.
Bottom of 1,
Close.
top of 2 is a staffing increase for the State Auditor's office.
Yep. House and close.
Mileage,
3,
not
mileage.
needed. PS, not needed.
House and house.
Then we move into the Office of the State
State
Treasurer.
treasurer.
Moable funding, that's top. That's the same for Governor and the House.
Yep. House and close.
New decision item in the
Pay
middle
plan.
of the page is not recommended.
House, close.
1 on to 2 is where you see his core. No changes there.
Okay. House and close.
Then their pay plan.
Mm-hmm.
Page 3 is advertising and auctions for abandoned fund. The new decision item is at the top of the page. There is same.
On 3, house and close. 4 on these.
4 is the MESAP. Again, no changes there.
House and close.
Page 5 is Treasury Information Fund. No changes.
House, close.
Page 6 was a PS.
Transfer.
Not needed.
House and close.
Page 7 is duplicate and
House.
outlaw checks. Not
House.
needed. Page 8 is the abandoned fund claims transfer. No core changes.
House and close.
New decision item was the same.
Transfer, house and close.
9 abandoned fund transfer.
Senator May, you got a question? You're all right. Seven. Yeah. Yes. Yes. Well, I mean, it's the department request, it's the governor's recommendation, and it's the House's recommendation. So everybody's the same. Yep.
Everything.
9.
9.
House.
10.
Same. House. 11. Link deposit
Yep.
refunds.
No changes.
House and close.
12 is debt offset.
Same. House and
There's
close.
an increase for that. Page 13 is a biennial GR to GR transfer. No changes.
Yep.
14 is state public school transfer. No changes.
House and close.
15 is a new decision item added by the governor at $2 million. The House is at $10
Let's
million.
go back to the Gov's recommendation there.
And 16 is the
16.
spending authority for
Yeah,
that.
so again, we'd keep it with the governor on that.
And we move to the Attorney General's office, no core changes.
House and close.
Pay plan, middle of the
Pay plan.
page on 2, that was both recommended by both.
900,000, house and close. 3,
Not needed.
mileage.
4 not
house.
needed. 5 is domestic violence section, no changes.
Yep, house and close.
6,
Pay plan.
this was
6,
reallocated.
initiatives. Yep,
to,
house, close.
to
Found crime
page
task
7.
force on 7.
Yep, same.
All the same, house and close, you got the pay plan.
Medicaid fraud on page 8, no changes.
All the same, house and close.
Page 9 is Missouri Office of Prosecution Services, no changes.
Yep, house and close.
Page 12.
Prosecutor.
Last 3 pages are all, they're kind of transfers for the
Yep.
AG, and there's no changes. There is on page 15, this is dealing with the new decision item you approved earlier for the Office of Child Exploitation
Right,
Awareness.
right, so go with the house on that.
Okay.
Then you got a transfer and another transfer on there. Okay,
Judiciary
Thank
would be
you.
the next book. General Assembly's coming up, last book in 12. They're yet to come. Yet to come.
I wonder if you and my vice chairman will have anything to talk about in that. You almost never do.
Page 12, Judiciary, page
Yep.
1. Judicial proceedings and review, no core changes.
House and close.
New DI was the same in the middle of the
Same.
page.
House.
Next one was not, next 2 were not recommended.
Yep, house. close.
Library renovations, that was moved to 20, as
Right,
was
so house and
the
close.
Supreme Court
All the
item.
way down the page.
Yep. Pay plan.
House and close.
Page 5 is for the Supreme Court judges,
Yep.
their
House
court
and
and
close.
their pay plan.
Yep, house, close.
Page 6 was mileage.
Mileage reimbursement, house and close.
7 was PS.
Judiciary PS, house and close.
8, you get into OSCA, the State Court Administrator, no core changes.
House,
Marijuana
Close.
initiative, the same.
all the same, house.
The next several items until you get to the bottom of page 10, which is pay plan. None of those items were recommended by the governor or the House.
Go with the house.
And we get to page 11, that's continuation of the pay plan.
Yep, top of page 11, house. Then I've got a couple of new NDIs, Missouri Juvenile Justice Handle with Care Model Program, 300,000, and then the Missouri Juvenile Justice Training and Coordination Raise the Age. If you guys remember that, Tony, 150,000 on that line. And close.
Okay.
12.
Page 12 is a new section where
Pretrial
they're.
pilot.
Yep. House reallocated that.
Yeah, they put a one-time designation on it. I would prefer that we just remove that, make it ongoing. So we'll go with the house, but then remove the one-time status. And
Got it.
close. 13.
13 is court improvements, no core changes.
House, close.
Not recommended, and then the pay plan, new DIs.
House, house.
15 is court automation, no changes
House.
to the core, same 2
Close.
pay plans.
Yep.
Page
House,
17
close.
is the GR transfer to the judicial training.
All
Core's the same. Yep.
House and close. Transfers, house. Pay
Page
plan.
19 is the spending authority for that program.
House and close.
21 is the Court of Appeals Western District staff, no changes to the core.
House, close.
And then we have the 2 pay plans.
Yep.
And a new DI
House.
not recommended. Page 23 is the staff for the Court of Appeals for the Eastern District.
Yep.
Same items.
House, close.
Page 25 is the Court of Appeals Southern District staff. No core changes. And then in the middle of page 26 is a new decision item that was not recommended by the governor or the House.
House.
Middle of page 26.
I'm on the middle of page 26. Want to add 55,755 PS and 3,695 E&E for a total of 59,450 and 1 FTE for a marshal in that section. All right,
Got
and
it.
close. 27. Pay plan.
Yep. 28,
House.
29, and 30 are the judges for the Western, Eastern, and Southern District and their pay plans. No changes.
Yeah, house on all those guys.
Page 31, we move to circuit personnel. The House did a minor adjustment to the core.
Yeah, house and close on that.
The marijuana initiative and the,
Yep.
and then
All the same there. House
Yep.
and close on that.
32 is for the court reporters. Governor and the House were the same.
Everybody's the same. House, close.
The next 2, 3 items. And the bottom of page 33, top of page 34 is juvenile detention centers.
Yep.
Those new DIs were not recommended.
House and close on both of those.
Same on 34, that was not recommended.
Yep. House, close on both of those.
And 35, the top of that page was not recommended. Middle of 35 is their pay plan. And then
House.
the top of 36 is E&E added for a treatment court commissioner for the 25th Circuit that the House added.
Got it. Yep. We can go with the House on that. Then at the bottom of the page, I got a couple of NDIs. Court reporter for the circuit judge in Cole County, PS and E&E, totaling $78,746. Court reporter and circuit judge in Pike, Lincoln counties, PS and E&E, totaling the same amount, $78,746. Court reporter and circuit judge in Callaway, Boone, for PS and E&E, same number, $78,746. We've got some courtroom upgrades going on in Greene County out of budget stabilization funds at $500,000, and the 22nd Circuit, St. Louis City, the Carnahan Courthouse, accessibility and security improvements out of budget stabilizations. That's $3,150,000, and then we've got a pilot program in 3 circuits for foster care children out of budget stabilization for $750,000. Those are urban, mid, and rural size counties to increase that adoption. That's Senate Bill 801. All right,
Got it.
and close on that.
Page 37
37.
is the page, this is for the judges and the commissioners in those circuit courts. No changes to the core.
Yep, House and all that.
We have their pay plan.
House.
The next treatment court for 39th was not recommended. And then the bottom of
Go with
38.
the House on 39. Go ahead.
And top 39 is the treatment court commissioner that they added for the 25th Circuit.
Yeah, and that's fine. Go with the House on that. Then this is where we're going to add NDIs of circuit judge in Pike, Lincoln counties, circuit judge in Callaway, Boone, and a circuit judge in Cole County, all at the same amount, $177,609 and 1 FTE. Right, Adam?
For each one of them, yes.
Yes. 39, that's closed. 40.
40, we move into CASA.
CASA, yep.
No core changes, the House increased.
House and close. Got an increase of 180 in the middle
41
of
is
the page. Yep.
domestic
House.
relations, no core changes.
Domestic relation, House and close.
42 is the Commission on Retired Discipline and Removal of Judges, no core changes.
House and close.
And again, you see the associated pay plans and new DIs,
Yep.
and then in the middle of page 43 is a House increase.
House and close.
Page 44 is the Appellate Judicial Commission, no changes.
House and close.
45 is Treatment Courts GR transfer.
Go with House and close.
then you have those equivalent new decision items for that section, the pay plan.
House, pay plan,
And then on
House.
47 and 48 is the expending authority for that.
Treatment courts, House and closed.
Middle of 48, the House added $250,000 for mental health court treatments in that section.
Yep, that's fine. Go with the House on that addition.
That would be that.
Thank you, Adam.
Public defender, we don't even need to open the book. It would be all House.
Well, she's been waiting for 2 days, and so I feel a little bad saying that.
Okay, page 1
Yeah, right.
is the Office of Director. There are no core changes.
Yeah, House.
Middle of the page is a new decision item.
Yeah, go
Then
with
the
the
3
House.
funding,
Yep,
their pay plan.
yep, House.
And we go to page 3, extraordinary expenses, conflict cases, no core changes.
4.7 million, House.
Page 4 is legal defense defender
Defender
fund,
fund,
no
House.
changes there. Page 5 is debt offset escrow, no changes.
House.
Page 6
closed.
is their grant section, no
Grants.
changes.
1.1 million,
And
House.
page 7 and
Mileage.
8 are mileage and PS from last year that are not needed.
House and House. Thanks for being here.
Last but not least, in 12. General Assembly. Page 1
Page 1.
is your salary pages. No changes to the core.
Okay. Go with the House.
The middle of the page was the governor originally recommended 3.2. The House removed that and replaced it with the item below
4.6.
for 4.6.
Yeah. Any conversation about that?
I'd like a Senate position to zero it out.
Yeah, we're going to take a... Senator, we... Page 1. That's right. Well, we took the House position on the core. You have a question about something else?
And this is 1.3, is what we're
Well, that's the core of the salaries for the senators, yes.
Okay, so I would like to increase that 1.3 million. Oh my God, can we increase that to 5 million?
I am, Senator, I am not comfortable with that kind of an increase. I think I'm going to support my vice chairman here, and we're going to, at the bottom of the page, the increase that you saw, we're going to go ahead and take a Senate position of 0 on that. Adam, make that change for us, and let's move on. No, we already closed. I'm sorry, Senator. We've closed that line. All right, page 3, Adam.
Is your mileage, yes.
Yeah, go with the House.
Page 4 is the per diems for
House.
senators. Page 5 is the Senate contingent expense for
House.
yes. Page 6 is joint contingent expense.
the
No
House.
changes. Page
Mileage
7
reimbursement,
was
House.
yes, and 8 was not needed.
Okay, go with the House.
Page
on
9, then we move into representative salaries. Top of the page is the core
that. House. Pay plan.
pay plan. Bottom of the page 9. Top of page 10.
They want to raise their pay, raise their pay. Being self-public servants.
Okay. I have, right, and you sit up. I have a question, Mr. Chair.
Senator May.
Okay, so I'm on page 9. Are you with me?
too.
So why is it there say 6.4 million and mine
Do
only
you,
says-
do you do you know how many representatives there are in the state of Missouri?
That's right, but we are the upper chamber. When you divide that, that means they're
I mean-
making equal to us, and we're the upper chamber, so we should make more money. That's all
I mean,
I'm asking.
Are you hearing like what you're saying?
I am,
Okay.
and I'm serious. I am serious. We are the deliberate chamber, and we work longer hours. We should make more. I'm serious. No, we need the senators to raise our salary. We need to go back. I mean, please, at $37,000, come on.
All right, Adam, at the bottom of page 9, we'll go ahead and take a Senate position there. Or I guess we can take a governor's position, right? Either way. We'll take a Senate position to 0. Take that 4.6 salary adjustment out. And close on that.
Page 11 is their mileage.
House, close.
Page 12 is per diem.
House and close.
Page 13 is the representing expense vouchers
House.
count.
Close.
Page 14 is for their staff house continuing expenses.
Yep. House and close.
Pay plan.
Yep.
Bottom page 14, top page 15 is an increase they added for that.
House and close.
Page 16 is their house revolving fund, no
Yep,
changes.
That's fine. House and close.
Page 17 is not needing as redistricting is complete.
Yep. House and close.
18 is associated with the mileage that was added, that's not needed.
Yep. House and close.
19 is top of the page is core
Dues.
for dues and
Yep.
then an increase
House.
for those dues.
House.
20 is an item added, most policy initiative added by the House.
Go with the House. It's fine. And close.
21 is then we entered the joint committees,
Right.
committee on legislative research admin, no changes to the core.
House.
Bottom of 21, top of 22 is a FTE position added by the House for that committee.
That's fine. House.
23 is Legislative Oversight Division, no core changes.
House and close.
24 is the Legislative Research Publisher Statute section, no
House.
changes. 25 is JCAR, no changes.
House and close.
26 is Joint Committee on Public Retirement Systems, no changes.
House and close.
27 is Joint Committee on Education.
House. Close.
28 is a new section added by the House for a transfer of funds from the Missouri State Capitol Commission Capital Preservation Fund to the State Capitol Commission Fund.
Yeah, that's fine. Go with House.
And then page 29 is the spending authority from that fund.
That's fine. House.
That concludes 12.
Okay, we're going to
Yep,
start
let's
with
go.
House Bill
House Bill
13, which
13,
is
real estate.
statewide real estate. 13.005. We'll go with the House with everything but Scruggs Station warehouse, and we'll go with the governor on that one. 1310 we'll go with the House. 1310 for the revolving trust fund, we're going to move that to 1320. 13.015 will go with the House. The NDIs will go with the House for everything but Scruggs and Fairgrounds, and we're going to go with the GovRec numbers, but we're going to move those to 13.010. And that will be the whole House
Perfect.
Bill 13. House Bill 17. There are two changes. The first one's 17.041. We are reappropriating the Center for School Safety from House Bill 2 from last year. And on page 4, we are going back with the GovRec for the mental health hospital for Kansas City. House Bill 18. The first change is on page 1, 18.010. We're going to increase that line by $434,000, 457 for the Department of Revenue. Page 2, we are moving two $15 million items from 18.025. Page 3, the first two items are what we just moved to the prior section. In the middle of that page, the $50 million, we are going back with the Gov on, and we're going with the Gov on the statewide Capitol complex. At the bottom of that page, we are adding 2.135 for the State Fair Fire Station, and that's all for House Bill 18. The rest of, excuse me, the rest of it is just House position. House Bill 19. The top of that page, we are adding $15 million for the Missouri State Prison Preservation from FMRF. We're going back with the Gov on the renovations line.
The whole Department of Natural Resources changes will go back to the gov on all of those. Let's see. The middle of that page, the Missouri National Guard, St. Joseph, Rosecrans will go with the governor position. Department of Corrections will go with the governor position. The Department of Elementary and Secondary Education, 19.030 will add Riverview Garden School District. 19.031 will add Webb Du Bois. Department of Higher Education and Workforce Development will add 4 vet tech programs. And then the bottom of that page will add the Gospel Music Hall of Fame. That's all the changes for House Bill 19. House Bill 20. In the middle of that page, section 20.030 will increase the Division of Professional Registration by $2 million. For the warehouse for storage in Cole County, we're going to reduce that line by $13 million, and that's just because they expended it that last year, or in this current fiscal year already. The St. Louis County soccer fields, 20.038, we're going to increase that line by $3 million. And we're going to add a new decision item for the Bolivar Early Child Care Career Center for $3 million. And that takes us to page 2. Dallas County Courthouse Jail renovation, we're going to increase that line by $500,000. 20.150, the First Responder Grant Program, we're going to move $9.5 million to section 20.199. And then in the middle of that page, 20.152 and 153, we're just reducing those to 0 because those have both been expended. Page 3. 20.224, we moved the daycare center to House Bill 8.
Senator May, what's your question?
Okay, in the middle of page 3, for 20.317 fairground renovations that was expended. The bottom of that page, 20.360, the Columbia bottom levy, we reduced the $15 million for the Fed because that was also expended. Page 4, the middle of that page, 20.376, we increased the convention center parking garage to by $5 million. We added a new decision item on 20.381 for the Plaza 18th Street Foundation. The bottom of page 4, we did a fund switch for the Mission St. Louis housing. We switched the Fed for GR. And on the bottom of that page, Three Rivers College, we increased that decision item by $5 million. Page 5, we went back with the governor recommendation on the digital government transformation on 20.510. 20.526, we went with a Senate position of 0 for the Crestwood Business Park. The middle of that page, 20.575 for the fire engine, we reduced to 0 because that has been expended. 20.603, we increased the decision item by $2 million for a children's psychiatric hospital in St. Louis County. Page 6, 20.611, the nursing college in Greene County, we increased that line by $7.5 million. Page 7, the middle of the page, 20.731, we moved the Eccles Hall to House Bill 6, and we increased the heavy equipment program at State Tech by $10 million. Page 8, toward the bottom of that page, 20.822, University of Missouri St. Louis, we funded that at $12.5 million out of budget stabilization funds. Page 9, the top of that page, 20.836, Northland Tech Career Center, we increased that line. And then we reduced the educational supply store in St. Louis by the $500,000. 20.851, Springfield Public School Ag and Youth Education Center, we reduced that line to 0. Section 20.855, the Voluntary Action Agency, we increased that line by about $1.5 million. Middle of page 10, or toward the bottom, 20.881, we decreased the St. Charles County stormwater by $2.5 million. The top of page 11, Starlight Theater, we reduced that item because it has been expended. Toward the bottom of page 11, we have Lambert Airport, we went back with the gov. I-35, I-29, we went back with the gov.
Yeah, that's the one I think we're gonna put that in with, instead of GR, Budget Stabilization Fund.
Okay.
Thanks.
The 20.915 State Data Center Resiliency, we went back with the gov. And 29.25 and 29.30, we went back with the governor on those two positions. Page 12, the top of that page, 20.945, we went back with the governor. 20.946, we moved that transfer to House Bill 12 and 6. 20.950 and 20.955, we went back to the governor on those positions. 20.996, we reduced the City of Fallon Police Department to 0. Page 13, the top of that page, 20.1015, we went back with the governor. 20.1017, we added a Dallas County shed project for $300,000. 20.1021, we went back with the governor for the Sullivan County Hospital study. 20.1028 and 20.1040, we went with the governor. I'm going to go back to 20.1025, and we went with the governor on that position to create a new transportation fund. Okay. 20.1096, we added a new decision item for St. Joseph Facility road improvements. 20.1121, we added a new decision item for Polk County Water Tower. 20.1122, Great Rivers Greenways. 20.1123, the Flood Resiliency Project in Atchison County. 20.1160, we increased that new decision item for Springfield soccer fields. 20.1176, we increased that decision item for the Mid-Missouri Sports Park in Boone County. There are two new decision items on 20.1177 for the community builders for $2 million and 20.1178 the South Loop Park for $30 million in budget stabilization funds. 20.1230 we went back with the gov. 20.1231 we took a new Senate position of $3 million for Lee's Summit Joint Operations Facility. The bottom of that page, 20.1331, we added a new decision item for $150,000 for Bridges of Hope, and 20.1332, a new decision item for $150,000 for Oasis Resource Center. Page 14, there are two new decision items for Camden County Fairgrounds for $4 million and 20.1336, and 20.1337, $950,000 for the FFA Foundation. And then next, we will have language and flex when we get that handed out. 20? Is that in 20? Is that right? Is it in 20? Yeah, it's in 20, so it's not on the language packet. Did we miss something? I don't know. It's up to Senator.
Language. And then we'll do flex after that. Or
Either
do you want
way.
to bounce back and forth as we finish a House bill? Doesn't matter. We can go back and forth.
However you want to do it. Flex is pretty easy,
Easy.
too. Yes. Language, so just some clarification with language. There's been some questions about maybe not seeing some items in here. If the committee went with the House on the amount that the House put in, and there was no question or concern with House language brought forward to staff, then we just left it at the House language. So that's why you do not see those items there in an attempt to cut this document down. So you will see mainly just changes or new Senate items in this document that reflect dollar changes or Senate adds.
And also language that was in a previous appropriations bill that was truly agreed and finally passed. That's not in here also because this committee hasn't changed, the players haven't changed, so all that language has already been voted on.
Question.
Senator Mack.
So so if we went with the House, but if the language is not right, do we correct it here or we add it? Or
What we're saying is if, see the House passed their bills, 3 weeks ago, something like that? What we're saying is if an issue hasn't come to my office, our staff's office, with language that the House used around a funding number associated with a project, then we assume that it was fine. Okay? That's why it's not in this packet.
I don't understand. I don't get it.
All right, let's get started on House Bill 2.
House Bill 2, the first section, we went back with the GovRec on that.
Yeah, so use the gov language.
The rest of the items on this page are Senate additions
Correct.
from
So
the committee.
Senate language on all of the first page and second page.
Correct. The
Top of
third
page 3.
page, yes, the House had this in. There was the Senate appropriation proposal has changes to that language.
Take the Senate position on that.
The next two are Senate adds.
So Senate language on both of those.
The bottom two relate to childcare, and we went with the governor with
Right,
the
so we're
number.
going to use the governor's language on the bottom 2 of 3.
And then on page 4, again, there's a Senate appropriation proposal because there's some changes to the House
So we're
language.
taking the Senate language there.
Same on
Same on
section
section-
2.510.
Yep.
And then we move to page 5, section 2.520. This is House language that's currently in House Bill 2.
And we're taking that out. So that top of page 5 is removed.
And then some recommended Senate language for section, or part 2, section 2.525.
Right. So we will take the Senate language at the bottom of 5. And that's all the language for House Bill 2. You want to do flex?
There is
I think
just
there's only one line.
one, yes. And the recommendation would be at the governor's.
Yeah, Senate recommendation back 100% flex between program in this subsection, the ESSER $3. All right, that's all the flex on that. House Bill 3.
Page 6, yes, is Department of Higher Education and Workforce Development. Again, the first page are new Senate committee ads.
So it's all Senate language on page 6.
Page 7 is updated language pre-apprenticeship program in St. Louis.
Right, Senate language there.
The Urban League of Metropolitan St. Louis, this is
We
Senate
added that, so
ad.
it's our language.
Some updated language for the computer
Launch
programming.
code,
Launch
Senate.
code.
And the A-Lot program bottom. Take Senate
Updated,
language on that also,
correct.
page 7.
And then on page 8 are 3 items added by the committee.
Right, so Senate language associated with the 3 items that we put in. So page 8's all Senate language. And that's all the
Page-
language on 3, so we got flex.
None. No
None on
differences.
3.
Flex
Perfect.
was handled the same way. If there were no issues with it, it stayed
Yep.
at the House rec.
Perfect.
Page
House Bill
9,
4. Yep.
this is core, this is pull tabs. You can see that the governor's, what the House removed was what's under the governor in bold.
Yeah, and we went back with the governor on that.
Okay? And then we move into the I-44 plan.
Right.
The Senate Appropriations Proposal is some updated language.
And Senate language on the bottom of 9.
Same on 10.
It's all I-44 related, so Senate language again. Same on the bond proceeds, bottom of page 10, Senate.
Top of page 11 is again I-44.
Same deal associated with the GR transfer, so that's Senate.
U.S. Highway 67 in Butler County, some updated language from the, proposed from the for the chair from
Yep.
the committee.
Senate language there.
The next 2 are items added by the committee
Right,
for
so
new projects.
Both Senate language on bottom of 11.
Top of page 12 is another item added by the committee.
Same, so that's Senate language on that.
The bottom of 12 is updated language to add the additional funding associated with that city that was added to that pilot
Yep.
program.
So Senate language on the bottom of 12.
Page
Rose
13,
Trans.
yes, that's, again, a piece was moved in from,
Go ahead, Adam. Page 13. Rosecrans, Senate.
yep,
Yep, Senate at the top.
Middle-
Kirksville Airport,
yes.
we added that, so that's our language.
and,
Scott County
yep,
Port
up-
improvements, also ours, so Senate on that one.
page, no flex differences in 4.
So now we're on House Bill 2005, Office of Administration,
First one is a new item added by the Senate.
so it's our language. I-70 is the next one, going back with the governor. Then we're back on the I-44 changes that we made, so Senate language there. The software
Software.
application bottom, let's remove that House language at 5610, Part 2. That's out. That finishes Senate Bill.
No flex for 5.
Oh, hell, okay. So 6,
6, Department of Ag, page 15 are all new Senate
all
ads.
Senate, so it's all
Miss-
Senate language associated with those ads. Yes,
Mr.
Senator
Chair,
May.
on that last item, can we add no match required?
On the Fresh Harvest 365?
Yes.
Sure. Put no match required on the bottom of that, Adam.
Got it. 16 is, again, Senate ads.
That's the Bay Farm at the top, right?
Mhm.
So
Eccles.
Senate on that, Eccles Hall, Senate. That was the wine and grape stuff.
The dairy,
Dairy industry, Senate, and then, the Mylan Senate.
Yes.
Yep, all Senate on that page. I'm on page 17.
DNR, again, 3 items added by, in the committee for water or sewer projects.
Yep, so all Senate language associated with the things that we added.
No flex in 6.
House Bill 7.
7 is DED. Again, page 18, these are
That's
all,
ours. Yep,
yes.
So all our language associated with
Miss-
our additions.
Mr. Chair,
Senator May.
on the 2 sections in, from the bottom, can we add MLK and family workforce, no match required?
you're on
I'm on
MLK
page
Development
18,
and which is the other
and
one?
the family workforce.
Yes. Got it.
Okay. 19
Yep.
are, again, are items added.
By us, so it's our
Yep.
language associated with the items that we added. 20,
20, same.
same deal.
Mr. Chair,
All Senate language. Senator May.
on the section 7.030 elevation workspace, can we also add no match required? Well, it doesn't, well, I know it's not, but that's what they tell me every time. And so this is a back and forth argument.
You bet.
So,
We're going to put no match on that.
thank you.
21, tax increment financing, house rec. You'll see some updated language to add Lakeport
Yeah,
Village.
Lakeport Village, go with our Senate proposed language
The
there.
next two are
Governor.
connected, so you take governor on both.
Governor on both of those. Forest products, NDI, our language.
Broadband grants.
Yeah, let's take the Senate on that also.
7145 Jazz Museum. This is part of a new item that was added.
Yeah, I mean, I think the only addition we've got to do there is the description of the community, right?
Correct.
Okay,
Kansas, yes, Kansas City. Yep.
we'll add
The
that.
tourism for golf, new DI, and the Route 66
Senate.
monument. Yes,
Department of Public Safety, 2008,
yes. All four items are
Senate,
new additions.
right?
25 8006 is updated language.
Yeah, I go with the Senate on that. Public Safety Child Care Center, NDI, so that's Senate.
And
Cannabinoid Enforcement, that's ours, so Senate. Eminence Fire Station, go Senate.
25, the first three are new items.
Yeah, so that's all ours. And then we went back with the governor on the ag disaster
yes.
resiliency, NDI. So
Yes.
go governor language there. 9,
Department of Corrections, the first item is crime victim notification, new DI added.
so that's our language. You got county jail reimbursement, and then we're going to use Senate language because we added, if you guys remember, we added another $5 million to those county reimbursements. So this would be the corresponding per day increase. Then we do
There's-
have flex on
Yes.
9, don't we?
Two items in 9 to reflect some of the budget changes that were made.
Go with the Senate on both of those, 60% PS and E&E and 100% flex on PS and E&E and the educational services. Good.
27, Department of Mental Health. First item was
Chip
with the-
transfer,
Yep, with the
cost
governor, right?
continue. Go back with the governor on that one. Swope Health, that was our ad, so Senate language. Same with North Kansas City Behavioral Health Improvement, Senate language. Same with Rogers Expansion, Senate language. C-Star Provider, St. Louis City Senate. Peer-to-peer recovery, go with the Senate on that. Behavioral health transport, Senate language also. PTSD, EMS, NDI, that's addition by us, so our language. HCBS enhancements, go back with the governor on that. And the DMH housing liaisons, go Senate language on that one. Right, Adam?
Yes.
All right, I'm on 29.
29, doorways.
Senate language on that.
Youth utilization increase, new DI.
Yep, Senate on that. Statewide, Senate on that one. Recovery Lighthouse, Johnson Pettis County, Senate. Language there. I'm on page 30.
Department of Health now.
Fentanyl testing, because we added that, so that's our language. Statewide EMS communication system, Senate. Graduate medical education, oh, those are the grants, so Senate on the bottom of page 30.
Top page 31, yes.
31, Senate, again, that was our NDI, so it's our language. The cardio, yeah.
Yep.
Emergency response, so Senate language on that. Part 2, at the bottom of 31, also going Senate language on that on the C-Star language. I'm on the top of 32.
Part 2, section 2020.
Let's take this out. Take the House language out. So remove that language. Actually, the top 2 sections, remove both of those House language adds. Then we're at the bottom of 32, 2035. Go with the Senate language there on the value-based purchasing reassessment program. I'm on the top of 33.
recommended language to add.
Yep, Senate on that, and then remove the House recommendation underneath there at the bottom of 33.
There is some flex for Department of Health,
Okay,
and it's kind of where Senate recommend, a proposal is kind of going in between what the House had 20%, Governor had 50. My understanding is 30 will work.
okay. That works. Go with the Senate position on the flex on House Bill 10.
Social Services, page 34. First three items were items added by the committee.
Well, then we'll take the corresponding Senate language associated with those items.
Bottom 34. There's
So
a
the
difference.
third-party eligibility, go with the House on
Okay.
that.
Page 35 are Senate
Our-
UDIs.
Yep, so our language on those,
36.
Mr. Chair,
Senator
on the,
May.
on the bottom one, can I add no match required?
Sure, Senator.
And at the top of 36, can I also add no match required?
Yes, that's fine.
Thank
All
you.
right.
36,
Next,
those items
these are all
were,
added.
yep.
These are all ours, so it's our language.
37 too, also.
Okay,
All
all Senate language.
38, same. All added. The first three on 39 are new adds.
Yep, so all Senate language, Boys and Girls Club, TANF, after school, go with the House recommendation, and the TANF out-of-school program, bottom of 39, go with the House.
40
It's our
are,
additions again, so it's our language, all of page 40. Page 41, top Arts Tech in Kansas City, use our language, it was our NDI. Good
Good.
Dads, go with the Senate proposed language in the middle of page 41. And again, the last two are NDIs on us, so take our language on those. I'm on the top of 42, Adam.
for the first three again
Yep,
are Senate
all
adds.
ours, so use our language. The bottom two go with the House, Children's Division Administration, and then Field Staff and Operations. I'm on the top of 43.
Yep.
Therapeutic foster homes go with the House recommended language there. Foster parent support, Senate. The kinship care in Jackson, Clay, Platte, Cass counties, NDI, so it's our language. And then the Children's Transition for Foster Care Technology Pilot Program, NDI, so our language at the bottom of 43. Physician Services, go with the Senate. Certified Community CCBHO, Senate language there, as well as the last two because they're both NDIs from us. Got Kirksville Hospital in Adair County, Senate language there. These are all our ads. so it's
45,
all our
yes.
language, right?
Yes, yes.
46.
46, top page is a new decision item.
So, Senate language on the top, Governor on the second one with the Title 19 transfer, right?
Yes, and Governor on
And then Governor on the
895.
next one, yep.
Yes.
Removing the next section, 11-20-20, from the House recommended language, and then taking the Senate approved language at the bottom of 46. 47.
47, part 2, section
Yeah, go with the
2025.
Senate language there, just corresponding with the per-day rate that we put in the budget. Part 2, Senate again, at the bottom of 47. 48.
2105, part 2 language.
Let's remove the House, both of those House recommendations at the top of page 48 will come out, and then we'll use the House language on the bottom of 48. That's the end of 11, so we'll go back to Flex.
Yeah, so they have a few items here. The Senate appropriations proposal is the same as the, okay, so the first one is the governor, the legal permanency. Supplemental nursing you see is, that's
35
associated
Flex instead of none, yes.
with something we added to the budget.
Yeah, go back to the Gov on the next one, Children's Field Staff and Operations.
The
Same.
last,
Go ahead.
the last four on the page would be 5% flex.
So we're just splitting in between
Yes.
the House and the Gov. That's fine.
The top of page 2, again, 5% flex. And the next two are at the governor's, 10%. Then we have 5 of them at 5%.
Mhm.
3% flexibility, that's legal expense fund. Youth treatments is same as governor. Pharmacy services and Part D also are same as the governor. Physician Services on page 3. And let's see here.
Went back pretty well with the governor, didn't
1, 2, 3, 4, 5, 6.
we? Yep,
The top 6 would be at the governor, 10%.
right.
Then assisted living facility, that's a new section, so we're adding some flexibility there. And then the last 2 on that page are also at the governor's 10%. Page 4, these are all for the rest of social services are at the governor's 10%.
Yep. All right, that finishes up flex on 11. Let's go back to our language packet and finish up the last 4 or 5 pages here.
49,
Elected officials, go back to the governor at the top of that. Symphonies, I mean, that's Senate language. Kansas City Museum, Senate language. Springfield, Senate language. Little Theater, Senate language. Lyric Opera, Senate. These are all Senate ads, so this is all corresponding Senate language, right, Adam?
yes, on page 50.
Yep, 51. Same deal there. Senate on the top. Juneteenth, Senate language on that. Kansas City Public Library, Senate, and then the charter school capital improvements went with the House on that language. And then the bottom of 51 went with the Senate proposed language. Top of 52, we've got Senate on the family law and criminal prosecution. Then we get into the judiciary. Juvenile justice handle care model program, Senate. Juvenile justice training coordination, raise the age, Senate. Pilot program for foster care and abuse and neglect, Senate on that. Then we get into the General Assembly. We're going with the House recommendation on the MOST policy initiative. Transfer to the State Capital Commission Fund. We're going with the House on that also. The House on the State Capitol Complex. And then global
up, baby?
language and all the operating bills. Just stating that funds that are expended in any municipality that enacts or adopts sanctuary policies in accordance with Section 67307 RISMO, any municipality that enacts or adopts a sanctuary policy has received state funds during the current fiscal year shall pay back all those funds with interest calculated by the statutory rate of interest as provided by subsection 408.040.4 RISMO. That's all the language.
There's one more flex.
One more flex.
Elected officials, we're going back with the governor.
That's fine. Bottom of page 4. That sounds good.
He needs to do roll call.
Yeah.
We taking that sanctuary shit out, right? So is that a 4 or 5 or send it substitute or what?
everything has a even 15. You made some changes.
Mr. Chair, I'm sorry. I hate to go back, but on page 53, the very last item basically states that any municipality that enacts or adopts a sanctuary policy, I think that those cities who accept refugees and other things, which is why they have sanctuary, should be excluded out of this. So could we add, so we would have to pay back the money that we received with interest for helping the refugees that have been placed in our community?
Senator, this is referencing a current state statute, and what it says is if somebody is here illegally in the country, so they do not fall in line with federal immigration law, that they have to return any money that is expended if they're a sanctuary city. A sanctuary city is defined as a city that fails to enforce federal immigration laws.
I understand that, but it just seems pretty prejudicial that this is only the cities that also accept the immigrants.
Well, this applies to all cities. I mean, the language that's here in front of us would apply
But
to
no
any
one
city in the
else
state.
is signed on to accept the refugees the way we have, and while they're being processed, they may be illegal in the country, and that's not fair to us to have to pay back any funding, especially when we are second or third in providing revenue to the state.
Well, look, all this provision is doing is reinforcing current state law, which says if somebody is illegally in the country and a city accepts them.
I understand what you're saying,
that under
Senator,
those
but when those
circumstances-
refugees arrive, they are illegally in the country.
Absolutely.
I've worked on those. I serve on the United Nations board. I work with those people all the time, and it takes a process for those refugees to become legal in our country. So Missouri, Kansas City has the #1 amount of refugees. St. Louis is 2. So what you are telling us is that we can no longer be a sanctuary for those people, and if we take them in, any money we get from the state for anything we get, we have to give that back with interest. That is not fair to us. That is wrong, and that because when you come here, regardless whether you came here, I know this is, more attacking, our people from the south of the border, but everyone that steps in here when they first get in here are illegal.
So you're saying that Kansas City is in violation of the law right now?
No, I'm saying that this shouldn't be in our budget because that's legislating through the budget. That's one.
It's not legislating.
It
through the
is
budget because it's
legislating
under
to the
current-
budget.
This is the case under current state law.
Does
If
the
you
current
read
state law say you have to pay back with interest?
The current state law does not say you have to pay back the
Then
interest,
you're
but that-
legislating through the budget.
I disagree. That's not legislating through the budget. We can put
We're talking
restrictions-
about money to be paid
we
back.
can put
Money,
restrictions-
anytime you're talking about money, Senator, respectfully, we're talking about the budget.
We can put restrictions on the payment and repayment of money in the budget.
Senator,
That's not
we have lost
legislating through the
millions
budget.
of dollars as a state in legal fees for attempting to do this on Planned Parenthood through the budget. If we are going to be the protectors of our state's budget and respect the citizens of this state, we have got to stop doing things that are going to cost us a lot of money in court. Senator, you worked at a large firm. I don't know. You probably charge $750, $1,000 an hour. And that's the type of lawyers that we're going to end up having to pay. I just respectfully ask that we need to work on this language because, one, I have a lot of refugees in my community. A lot. And I don't want to not take them because unlike anybody else in this room, I've been to a refugee camp in Africa. And I want them to be able to come here and be safe, be able to work, be able to go to school, be able to eat, and do the things that they do. Be entrepreneurs if they want to. These people can't work in these refugee camps in other countries, which is why we work globally to bring them to places where they can be safe. But they are not legal when they come here. I'm not saying that my city is violating anything. I am telling you the reality of when I get off the boat from wherever, from Somalia, I still have a process to go to. I come right here immediately, and I have a process before I am a legal refugee or illegal immigrant. All asylum people still have to go through a process. They don't just walk in, and these people aren't waiting for the process to be done before they get here. They're approved to come here, they come here, and then they still have to go through that process. And to say that ones have to pay back, if that's not already in the statute, then we're putting statutory language in the budget, which we have paid millions of dollars for, to lose this very issue when we did Planned Parenthood, which is why we did the legislation statutorily on the, not that I agree with it, I just want everybody to listen to understand, but we did that statutorily on the floor to defund Planned Parenthood because we have been told repeatedly by the Missouri Supreme Court that you cannot do that through the budget. So I respectfully ask that either we remove this or that we put some exceptions for those cities who have become a safe haven for our refugees. I mean, you know, it's already hard to protect them. We had one young man got shot because somebody thought he was 6 feet tall, and he got shot in the chest because he went to the wrong house. So I don't want Ralph Yarl or other people to have to go through what they go through in other countries. I want them to come here. I want them to be safe. And I don't want our city to be punished because we are helping those folks.
Thank you, Senator. I make a motion we go into executive session. Do I have a second? I got a second. We're in executive session. I make a motion that we bring it before the body for consideration. House Committee Substitute House Bill 15. This was the second supplemental bill that we heard, I don't know, yesterday morning. Do I have a second to bring that up before the body for consideration? I've got a second, but the House Committee Substitute is before the body. I now make a motion that we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 15. Do I have a second? I've got a second. Any discussion on the adoption of the Senate Committee Substitute on House Bill 15? 2015, if you want me to say that, Adam.
However.
Hearing none, make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill 15. Do I have a second? I do have a second. Adam, please call the roll on the
To
do
do
pass
pass
motion.
Senate Committee Substitute for House Committee Substitute for House Bill 2015, Senators Huff,
Aye.
Luke Temeyer,
He's present. Yeah.
Arthur, Bean, Black, Brown, Searpoy, Crawford, Esslinger, May,
Aye.
Thompson Raider, Washington, Williams. That's 12 for, 1 present.
By your vote of 12 aye and 1 present, you have voted do pass Senate Committee Substitute for House Committee Substitute for House Bill 15. I now make a motion we bring it before the body for consideration. House Committee Substitute for House Bill number 2002. Do I have a second? We got a second. The bill is before the body. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 2. Do I have a second? I've got a second. This is Desi. Any discussion on the adoption motion of the Senate Committee Substitute? Hearing none. I make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill 2. We got a second. Adam, call the roll. on the
For
do
Senate
pass
Committee
motion.
Substitute for House Committee Substitute for House Bill 2002, Senators Huff, Luke Temeyer, Arthur, Bean, Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Raider, Washington, Williams. That's 13, Senator.
By a vote of 13 aye and 0 no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill number 2. I now make a motion we bring it before the body House Committee Substitute for House Bill 2003. Do I have a second? I have a second. I now make a motion that we adopt the Senate Committee Substitute for House Committee Substitute for House Bill number 3. Do I have a second? I've got a second. Any discussion on the adoption motion of the Senate Committee Substitute for House Committee Substitute for House Bill 2003? Hearing none. All those in favor of adopting the committee substitute, say aye. Aye. Those to the contrary, say no. The ayes appear to have it. The ayes do have it. You've adopted the Senate Committee Substitute, House Committee Substitute, House Bill 2003.
Mr. Chair, before you call roll, I do need to say for House Bill 3, I do have a potential conflict with it,
Sure.
so I won't be able to vote.
Okay.
Thank you.
Thank you, Senator. We have adopted the Senate Committee Substitute. Now make a motion we vote out do pass the Senate Committee Substitute, House Committee Substitute, House Bill 2003. Do I have a second? I've got a second. Any discussion on that do pass motion? Hearing none. Adam, call the roll on the do pass motion.
For do pass for Senate Committee Substitute for House Committee Substitute for House Bill 2003, Senators Huff,
Aye.
Luke Temeyer, Arthur, Bean, Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Raider, Williams.
13?
12.
By your vote of 12 aye and 1 present, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill 2004. I now make a motion we bring it before the body for consideration. House Committee Substitute for House Bill 2005. Do I have a second? I've got a second. The bill is before the body. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 2005. Do I have a second? I've got a second. Any discussion on the adoption motion of the Senate Committee Substitute for House Committee Substitute for House Bill 2005? This is OA. This is 4. Oh, skipping ahead. All right, we'll redo it real quick. Make a motion that we bring it before the body for consideration. House Committee Substitute for House Bill 2005. Do I have a second? I've got a second. The bill's before the... Is it 4 or 5? 4. 4? 4. All right, let's bring before this committee House Committee Substitute for House Bill 2004. Second. We've got a second on that. I now make a motion that we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 2004. Second. Thank you, Tony. Any discussion on the adoption motion of the Senate Committee Substitute for House Bill 2004? Hearing none. All those in favor of adopting the Senate Committee Substitute, please say aye. Those contrary say no. The ayes appear to have, the ayes do have. You've adopted the Committee Substitute. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill 2004. Do I have a second? We've got a second. Any discussion on the do pass motion on House Bill 2004? Hearing none. Adam, call the roll.
Senate Committee Substitute for House Committee Substitute for House Bill 2004. Senators Huff,
Aye.
Luke Demeyer, Arthur, Bean, Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Rader, Washington, Williams. 13-0, Senator.
By your vote of 13 aye and 0 no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill 2004. Now make a motion to bring it for consideration before the committee, House Committee Substitute for House Bill 2005. Do I have a second? I have a second. The bill is before the committee. I now make a motion we adopt the Senate Committee Substitute for the House Committee Substitute for House Bill 2005. Do I have a second for that? We got a second for that. Any discussion on the adoption motion of the Senate Committee Substitute? Hearing none. All those in favor of adopting the Senate Committee Substitute, please say aye. Those to the contrary say no. The ayes appear to have, the ayes do have. You have adopted the Senate Committee Substitute. I now make a motion we do pass Senate Committee Substitute for House Committee Substitute for House Bill 2005. Do I have a second? I have a second. Any discussion on the do pass motion on House Bill 5? Hearing none. Adam, call the roll.
Senate Committee Substitute for House Committee Substitute for House Bill 2005 to do pass. Senators Huff, Luke Demeyer, Arthur, Bean, Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Rader, Washington, Williams. 12-0, Senator. 13-0.
By your vote of 13-9-0 no, you voted do pass on the Senate Committee Substitute for House Committee Substitute for House Bill 2005. And now make a motion to bring it for consideration before the committee, House Committee Substitute for House Bill 2006. Do I have a second? I have a second. The bill is before the body. I now make a motion we adopt the Senate Committee Substitute for the House Committee Substitute for House Bill 2006. Do I have a second? I've got a second. Any discussion on the adoption motion of the Senate Committee Substitute? Hearing none. All those in favor, please say aye. Those to the contrary say no. The ayes appear to have, the ayes do have. You have adopted the Senate Committee Substitute. And now make a motion we vote out do pass Senate Committee Substitute for House Committee Substitute for House Bill 2006. Do I have a second? I've got a second. Any discussion on the do pass motion on House Bill 2006? Hearing none. Adam, please call the roll on the
To do
motion.
pass, Senate Committee Substitute, House Committee Substitute, House Bill 2006. Senators Huff,
Aye.
Luke Demeyer, Arthur, Bean, Black, Brown, Searpoy, Esslinger, Crawford, May, Thompson Rader, Washington, Williams. 13-0.
By your vote of 13 aye and 0 no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill 2006. And I make a motion to bring before the body consideration House Committee Substitute for House Bill 2007. Do I have a second? I have a second. The bill is before the body. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 2007. Do I have a second? I have a second. Any discussion on the adoption motion of the Senate Committee Substitute? Hearing none. All those in favor, please say aye. Those to the contrary say no. The ayes appear to have, the ayes do have. You've adopted the Senate Committee Substitute. I now make a motion we vote out do pass Senate Committee Substitute for House Committee Substitute for House Bill 2007. Do I have a second? We've got a second. Any discussion on the do pass motion on House Bill 2007? Hearing none. Adam, call the roll.
To do pass, Senate Committee Substitute, House Committee Substitute, House Bill 2007. Senators Huff,
Aye.
Luke Demeyer, Arthur, Bean, Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Raider, Washington, Williams. 13-0.
By a vote of 13-0, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill 2007. I now make a motion we bring it before the body for consideration House Committee Substitute for House Bill 2008. Do I have a second? Second. I have a second. The bill is before the body. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 2008. Do I have a second? Any discussion on the adoption motion of the Senate Committee Substitute? Hearing none. All those in favor of adopting the Senate Committee Substitute for House Bill 2008, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. We have adopted the Senate Committee Substitute for House Committee Substitute for House Bill 2008. I now make a motion we vote out do pass Senate Committee Substitute for House Committee Substitute for House Bill 2008. Do I have a second? Second. I have a second. Any discussion on the do pass motion? Hearing none.
To do pass Senate Committee Substitute, House Committee Substitute, House Bill 2008, Senators Huff,
Aye.
Luke Demeyer, Arthur, Bean, Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Raider, Washington, Williams. 13-0.
By your vote of 13-0, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill 2009. I now make a motion 8. That was 8, right?
That was 8.
That was 8. We passed the do pass motion on House Committee Substitute for House Bill 8. I now make a motion we bring it before consideration House Committee Substitute for House Bill 2009. Do I have a second? I've got a second. The bill's before the body. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 2009. Do I have a second? Second. I do have a second. Any discussion on the adoption of the Senate Committee Substitute for House Bill 9? Hearing none. All those in favor of adopting the substitute, please say aye. Aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute. I now make a motion that we vote out do pass Senate Committee Substitute for House Committee Substitute for House Bill 2009. Do I have a second? Second. I have a second. Any discussion on the do pass motion? Hearing none. Adam, call the roll.
Senate Committee to do pass Senate Committee Substitute, House Committee Substitute, House Bill 2009, Senators Huff,
Aye.
Luke Demeyer,
Aye.
Arthur,
Aye.
Bean, Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Raider, Washington, Williams. 13-0.
By your vote of 13-0, you have voted do pass Senate Committee Substitute for House Committee Substitute for House Bill 2009. I now make a motion we bring it before the body for consideration House Committee Substitute for House Bill 2010. Do I have a second? Second. I've got a second. The bill is before the body. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 2010. Do I have a second? I have a second. Any discussion on the adoption of the Senate Committee Substitute? Hearing none. All those in favor, please say aye. Aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You've adopted the Senate Committee Substitute. I now make a motion we vote out do pass Senate Committee Substitute for House Committee Substitute for House Bill 2010. Do I have a second? Second. I've got a second. Any discussion on the do pass motion? Hearing none. Adam, call the
To
roll.
do
on the
pass
motion.
Senate Committee Substitute, House Committee Substitute, House Bill 2010, Senators Huff,
Aye.
Luke Demeyer,
Aye.
Arthur,
Aye.
Bean, Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Raider, Washington, Williams. 13.
By your vote of 13-0, no, you voted do pass House Senate Committee Substitute, House Committee Substitute, House Bill 2010. I now make a motion we bring it for consideration before the body. House Committee Substitute for House Bill 2011. Do I have a second? I have a second. The bill is before the body. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 2011. Do I have a second? I have a second. Any discussion on the adoption motion of the Senate Committee Substitute for House Bill 11? Hearing none. All those in favor of adopting the Senate Committee Substitute, please say aye. Aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute for the House Committee Substitute for House Bill 2011. I now make a motion we vote out do pass Senate Committee Substitute for House Committee Substitute for House Bill 2011. Do I have a second? I have a second. Any discussion on the do pass motion? Hearing none. Adam, call the roll on the do pass motion for Senate Committee Substitute for House Committee Substitute for House Bill 2011.
To do pass Senate Committee Substitute, House Committee Substitute, House Bill 2011, Senators Huff,
Aye.
Luke Demeyer,
Aye.
Arthur,
Aye.
Bean, Black, Brown, Searpoy, Crawford, Esslinger, May, Thompson Raider, Washington, Williams. 13.
By your vote of 13-0, no, you voted out do pass Senate Committee Substitute for House Committee Substitute for House Bill 2011. I now make a motion to bring it for consideration House Committee Substitute for House Bill 2012. Do I have a second? I have a second. The bill is before the body. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 2012. Do I have a second? I have a second. Any discussion on the adoption motion of the Senate Committee substitute associated with House Bill 12? Hearing none. All those in favor of adopting the Senate Committee substitute, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee substitute. I now make a motion we do pass Senate Committee substitute for House Committee substitute for House Bill 2012. Do I have a second? I have a second. Any discussion on the do pass motion associated with House Bill 12? Hearing none. Adam, call the roll
do
on the
pass.
do pass motion for
Senate.
Senate Committee substitute for House Committee substitute for House Bill 2012.
Senate Committee substitute, yes, for 2012. Senators Huff.
Aye.
Lukemeyer. Arthur. Bean. Black. Brown. Searpoy. Crawford. Esslinger. May. Thompson Rader. Washington. Williams. 13-0.
By your vote of 12 aye and 1 present,
He said, oh, I thought he said, sorry.
you have voted do pass Senate Committee substitute, House Committee substitute for House Bill 2012. I now make a motion we bring up before the body for consideration House Committee substitute for House Bill 2017. Do I have a second? I have a second. The bill is before the body. I now make a motion we adopt the Senate Committee substitute for House Committee substitute for House Bill 2017. Do I have a second? I have a second. Any discussion on the adoption motion of the Senate Committee substitute associated with House Bill 2017? Hearing none. All those in favor of adopting the Senate substitute, please, or this committee substitute, please say aye. Aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee substitute. I now make a motion we vote out do pass Senate Committee substitute for House Committee substitute for House Bill 2017. Do I have a second? I have a second. Any discussion on the do pass motion? Hearing none. Adam, call the roll.
To do pass House Bill 2017, Senators Huff.
Aye.
Lukemeyer. Arthur. Bean. Black. Brown. Searpoy. Crawford. Esslinger. May. Thompson Rader. Washington. Williams. 13-0.
By a vote of 13-0, you have voted do pass Senate Committee substitute for House Committee substitute for House Bill 2017. I now make a motion we bring it before the
Senator?
body.
We skipped 13. My fault.
Oh, you want to do it now?
Yes.
Okay. Let's do. Couldn't hurt. Now make a motion we bring it before the body. House Committee substitute for House Bill 2013. Do I have a second? I have a second. I now make a motion. The bill is before the body. I now make a motion we adopt the Senate Committee substitute associated with House Committee substitute for House Bill 2013. Do I have a second? I have a second. Any discussion on the adoption motion of the Senate Committee substitute? Hearing none. All those in favor of adopting the Senate Committee substitute, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You've adopted the Senate Committee substitute. I now make a motion we vote out do pass Senate Committee substitute for House Committee substitute for House Bill 2013. Do I have a second? I have a second. Any discussion on the do pass motion associated with House Bill 2013? Hearing none. Adam, call the roll on the do pass motion. Senate Committee substitute, House Committee substitute, House Bill 2013.
For 2013, Senators Huff.
Aye.
Lukemeyer. Arthur. Bean. Black. Brown. Searpoy. Crawford. Esslinger. May. Thompson Rader. Washington. Williams. 13-0.
By a vote of 13 aye and 0 no, you voted do pass Senate Committee substitute for House Committee substitute for House Bill 2013. I now make a motion to bring it before the body. House Committee substitute for House Bill 2018. Do I have a second? I have a second. The bill is before the body. I now make a motion that we adopt the Senate Committee substitute for House Committee substitute for House Bill 2018. Do I have a second? I have a second. Any discussion on the adoption of the Senate Committee substitute associated with House Bill 2018? Hearing none. All those in favor of adopting the Senate Committee substitute, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee substitute. I now make a motion we vote out do pass Senate Committee substitute for House Committee substitute for House Bill 2018. Do I have a second? Second. I've got a second. Adam, please call the roll on the do pass motion.
To pass for 2018, Senators Huff.
Aye.
Lukemeyer. Arthur. Bean. Black. Brown. Searpoy. Crawford. Esslinger. May. Thompson Rader. Washington. Williams. 13-0.
By your vote of 13 aye and 0 no, you voted do pass Senate Committee substitute for House Committee substitute for House Bill 2018. I now make a motion we bring it before the body for consideration. House Committee substitute for House Bill 2019. Do I have a second? I have a second. The bill is before the body. I now make a motion we adopt the Senate Committee substitute for House Committee substitute for House Bill 2019. Do I have a second? I do have a second. Any discussion on the adoption motion of the Senate Committee substitute? Hearing none, all those in favor of adopting the Senate Committee Substitute for House Committee Substitute for House Bill 2019, please say aye. Those to the contrary say no. The ayes appear to have it. The ayes do have it. You have adopted the Senate Committee Substitute. I now make a motion that we vote out do pass Senate Committee Substitute for House Committee Substitute for House Bill 2019. Do I have a second? I have a second. Any discussion on the do pass motion? Hearing none. Adam, please call the roll on the do pass motion.
To do pass, Senate Committee Substitute, House Committee Substitute, House Bill 2019, Senators Huff.
Aye.
Luke Tomeyer. Arthur. Bean. Black. Brown. Searpoy. Crawford. Esslinger. May. Thompson Rader. Washington. Williams. 13-0.
By your vote of 13-9, no, you voted out. Do pass Senate Committee Substitute, House Committee Substitute for House Bill 2019. I now make a motion we bring it before the body, House Committee Substitute for House Bill 2020. Do I have a second? Second. I have a second. The bill is before the body. I now make a motion we adopt the Senate Committee Substitute for House Committee Substitute for House Bill 2020. Do I have a second?
Second.
Thank you. I do have a second. Any discussion on the adoption motion on the Senate Committee Substitute? Hearing none. All those in favor of adopting the Senate Committee Substitute for House Bill 2020, please say aye. Aye. Those to the contrary say no. The ayes appear to have. The ayes do have. You've adopted the Senate Committee Substitute. I now make a motion we vote out do pass Senate Committee Substitute for House Committee Substitute for House Bill 2020. Do I have a second? Second. I've got a second. Any discussion on the adoption motion of the Senate Committee Substitute? Hearing none. Adam, call the roll on the do pass motion of Senate Committee Substitute for House Committee Substitute for House Bill 2020.
To do pass, House Bill 2020, Senate Committee Substitute, Senators Huff.
Aye.
Luke Tomeyer. Arthur. Bean. Black. Brown. Searpoy. Crawford. Esslinger. May. Thompson Rader. Washington. Williams. 13-0.
By your vote of 13-9, no, you voted do pass Senate Committee Substitute for House Committee Substitute for House Bill 2020. I make a motion we go out of executive session. I have a second. I've got a second. We're out of executive session. I'm not going to belabor this because we've been here all day. I appreciate the work of the committee, and I very much appreciate the work of our staff, given the time constraints that we often work under. I'm not going to say go by and tell them thanks, but if you see them, tell them thanks, because this is a long process, and we've just made at least another step in the right direction. So thanks for all the help, guys. Appreciate it. We're adjourned.